together. As we initiate chaos theory guarantees that we'll play like lightning shots, sounding like thunder. For every time in the face that it hits us, we're faster. Well, they should know by now. They see the world keeps trying to shake us. It only wakes us. The pendulum swings. The pendulum swings. It's in a beautiful darkness. Only another. It's full steam ahead. Full steam ahead. All above the Petty Express. Misdirected from the start. It's a runaway train. Come on, freight train. I come on, freight train. In a beautiful darkness, the Petty Express. In a beautiful darkness.
Well, welcome back to Trial Watch on the Petty Express with Mo. As promised, we do have the white snake of all hairdos, the absolute icon of the 70s, and a loving homage to, honest to goodness, I am jealous of the court clerks, just general heart white snake vibes in her hairstyle. So we do have that. Mike, I was wondering the sound sounded. For the love of Cheetos. Now everything sounds normal. Thank you guys. I had to restart everything. We had a slight internet snafu and Mr. Mo had to unplug the modem and turn it back on. And when that happens, all of my signals get wonkified. And you know, we couldn't get anywhere without Scorn, though. So just a subtle sign of my discontent with the Commonwealth and their Bo shenanigans, their Bo-nanigans, if you will. I am most thoroughly done, I think, along with the rest of humanity, with these ridiculous bows in lieu of a competent, intelligent, and coherent trial. So now we did stop yesterday because I thought that the Commonwealth, lacking any sort of soul or intelligence or just strategy of any kind, was going to go from, medical examiner to medical examiner to medical examiner. And I honestly could not do that. So I did stop, but it turned out to be a pretty good day for the defense. Now, there are going to be a lot of witnesses that knew Lindsay personally in the past that are going to give us some more insights. And it actually turned out to be a pretty good day for the defense because of all of the people in Lindsay's live showing that she was, in fact, trying to reach out. Now, she didn't do it in the cartoonish 1950s parody way that the Commonwealth wanted her to do, but people around her noticed she was struggling, and it didn't seem put on or false or manipulative to any of them. So I am a little disappointed in that we did miss some really good testimony, but we're going at our own speed and we are here today. So that's kind of where we are to orientate yourself. But let's get into this.
This court's now in session. Please be seated.
Your Honor, for the purpose of the record.
Oh, okay. I thought we were going back to the beginning, but no.
SSHIRT.
And what do you do for a living?
I'm a pediatrician.
Where do you work?
I work at Clancy Pediatrics.
Back in 2023, where did you work?
South Shore Medical Center.
And how long did you work there at that point?
In 2023, I think I had been there for about 7 years.
And could you just briefly describe for us your educational and training background that enables you to be a pediatrician?
Yes, I completed medical school at UConn and then did my pediatrics residency at Mass General.
And when you were working at the South Shore practice in 2023, were you assigned as a pediatrician for the Clancy family?
Yes.
And how long had you been their pediatrician?
I'm sorry, how long had I, can you repeat that question?
How long had you been the family pediatrician for the Clancys?
I believe I started seeing them around 2019.
And And in the practice that you were in at that time, was it just yourself, or were there other doctors and nurse practitioners and staff that would treat and see patients?
It was a somewhat large group.
And so would you always be the one treating the Clancy children, or would some of your associates sometimes see the children?
I did all the checkups, but if there was a sickness and I wasn't there that day, they would be seen by another provider.
And by checkup, are you referring to a physical or well visit?
Yes.
And then if, for example, one of the children were ill and the family called to make an appointment, they would see who's available?
Yes.
Tell me you've never had children without telling me you've never had children. All of these concepts are so like baseline normal that the actual elaboration of them does make it clear that the Commonwealth, it does tend to lend itself to the conspiracy that these two women have never had children, because this is normal kind of everyday thing. Yes, all of my kids have their, assigned pediatrician. But if it's a med check or something like that, or, sometimes even a well visit to get it within schedule and doctors are allowed to take vacation, they will go to a different pediatrician in the practice.
They would always check my schedule first, but often have to see someone else.
And would you have access to their records as their lead pediatrician to review if they came in for a sick visit or something like that, to keep yourself updated?
Yeah, often at the time of the checkup is when we will go back and see what visits they've had since the last time we saw them.
This time would move to submit the pediatric records from South Shore Medical Center for Cora, Dawson, and Clancy.
Any objection?
By agreement.
That may be admitted.
Thank you.
Now, what I will find telling here is that, and I don't know, I can't speak for all pediatricians' offices and things like that, but I was very impressed and encouraged by my pediatrician's office that whenever I would bring in my newborn or, a new child, part of that newborn intake visit was seeing how I was adjusting, how I was doing, if I was getting enough sleep, things like that. So it will be telling if this particular pediatrician noted, changes in any sort of family dynamic. And it's not over every pediatrician. I specifically picked a pediatric group that was more holistic and, it's Christian based. So there is more kind of interaction on a deeper level. And I chose that. So I don't know if it's available at every pediatrician, but I do know that my pediatrician always kind of did try to touch base with me as the parent. And it will be interesting to know if she noticed changes in Lindsay.
If we could focus for a moment on Callan Clancy. He was born in May of 2022, correct?
That sounds right, yes.
And you were his pediatrician from the time he was born?
Yes.
While you were his pediatrician, did his mother, Lindsay Clancy, ever talk to you about Callan having issues taking a bottle?
Not that I can remember.
Was there anything out of the ordinary health-wise with Callan?
No.
Was there any issues, or were there any issues with him meeting his milestones?
No.
And this is such a bullshit way to do this. Basically, what the Commonwealth is trying to portray by asking these questions is all of the sort of self-recrimination and mom guilt and anxiety, intrusive thoughts about Callum not missing or not meeting his milestones and his developmental marks were part of the mental illness. So what the Commonwealth is doing here without realizing it is highlighting that Lindsay was she was having these intrusive thoughts about irrational things. She would go to the pediatrician. If anything, they are weakening their case because she was going to a pediatrician. She was being told that Callum was doing fine. And yet her brain could not stop that the relentless cycle in her head that he's not meeting milestones, that you're a terrible mother, that, you're doing something wrong, and that is why he is failing to do X, Y, and Z. You are absolutely proving the point you do not want to be making, that she was outside of touch of reality. Commonwealth. Maybe the bow is supposed to help. Maybe the bigger the bow, the smarter the brain. I don't know. Maybe get a bigger one, because what you're wearing right now isn't helping.
What about Dawson Clancy? Did he have any health issues or concerns that you were aware of?
If I recall correctly from the notes, I think just a peanut allergy, if I remember, but otherwise he was healthy.
And Cora Clancy, did she have any medical issues?
I think asthma, that was pretty well controlled, but she was also healthy.
Now, in your role as a pediatrician, are you aware of postpartum issues, and are there certain things that you look for in new moms when you're treating babies?
Yes, we're certainly aware of it, and we try to look for any kind of out.
What do you do in terms of treatment or care when you see those things?
Yes, so since we're obviously caring for the child, we are not really able to diagnose or manage anything for the mom, but we do try to connect her with resources, whether Massachusetts has some postpartum resources, or often we'll refer to have her try to contact her OB.
When you were interacting with Lindsay Clancy, when you were treating her 3 children, did you ever...
Okay, we are skipping through the Commonwealth. They are being absolute butt monkeys. And as always, we get the real truth from the defense.
And when you recommended the Miralax, thank you.
Good morning.
Good morning.
What's the time frame that you dealt with?
Oh, and free the First Amendment. Good morning. Just popped in to say hi. Today's feeling really crappy, so I'll be sleeping on and off. Well, yucks. Sorry you're having a crappy day. Thank you. Wishing you a calm trial day. Well, I know it's going to be frustrating, but it was supposed to be very good for the defense. And, Attorney Reddington seems to have done a really good job of pointing out where the Commonwealth tried to shade a lot of things to make Lindsay look more manipulative or cunning, and just how false those kind of premises and those questions were.
The Clancy children, because you took care of all 3 of them, right?
All 3,
Right.
Yeah. Cora, I believe, was around 9 months old, so I want to say that I saw them from about 2019 until 2013.
And when you would see the children, who would bring the children to see you for the checkups? Was it Lindsay, or was it Lindsay and Patrick, or was it?
I think that Lindsay and Patrick came together for one of Cora's checkups, but as far as I can remember, every other visit was always Lindsay.
And being an experienced pediatrician and being very protective of your patients, little kids, you're always looking to see if there's anything out of the ordinary, bruising, anything indicative of any type of psychiatric problems they may have, stunted growth or anything. Is that correct?
Yes.
You're always on the lookout for anything else, even if it's not mentioned to you, right?
Right. Mm-hmm.
Did you ever notice anything like that on the Clancy kids?
No.
Did they seem healthy?
Yes.
Did they seem happy?
Yes.
And all the times that you would see Lindsay with the kids at your office,
Mm-hmm.
Did she appear to be a doting or concerned mother for the children?
Yes, she did.
One of the questions that the DA had asked you is whether or not you're familiar with postpartum depression, postpartum psychosis, things of that nature.
Mm-hmm.
Would you agree with me, in your experience, extensive as it is, that a person can be suffering from postpartum depression and or postpartum psychosis and still talk?
I'm not sure I have enough expertise to explain, to answer that well.
That's fine. That's fine. Thank you.
And you know what? I actually very much appreciate that from the witness. Now, my ridiculous behind loves to opine on anything, whether I have the credentials and iota of sense about it or anything else. Um, but I do like the humility displayed with, you know what? That is way outside my wheelhouse, and I would rather not, you know, I'd rather not say yes or no. I like witnesses like this. I know that it might be irritating to other people, but I'd much rather a witness be humble and say, you know, that is not my wheelhouse. I couldn't give you a real professional answer.
Yeah.
Was Lindsay the type of person, to your observation and your treatment of her, that she was kind of like, was she like a complainer? Would she complain to you about the kids being a pain in the neck and that she was aggravated with the children or anything like that?
Not that I remember, no.
In all of the times that you had seen her, let's focus, say, on the year of 2022 up through 2023, January 24th, when you saw the children, I'm sorry, Cora, I believe it was, last. Counsel had asked you whether or not you made any observations that you would have noted if she appeared to be suffering from any symptomology of postpartum. Do you recall her asking you that?
Yes.
And in your treatment of the children and in your observations of Lindsay, did you know, or did she indicate to you, or did Patrick indicate to you, or anybody indicate to you that in October of 2022, she was seeing a psychiatrist?
No.
Do you know Dr. Tufts?
No.
Did you know that after seeing Dr. Tufts that she was placed on a selective serotonin reuptake inhibitor, SSRI, Zoloft?
No, I didn't know that.
And again, you're the pediatrician. It's not your job to pry. I mean, if you see something, you would make note of it and try to help them out. But I mean, if they don't tell you, you don't know, right? Did you know, fair to say that you didn't know that she was then seeing a Dr. Paul, and then Paul left the practice and nurse practitioner Gelada?
I didn't know that.
Okay. Do you know them?
No.
The only reason why I ask if you know them is that South Shore Medical Center, is that affiliated with South Shore Hospital?
I believe it was already owned by the hospital at that time.
Okay.
Mm-hmm.
Latasha Dukes, nothing about her?
No.
Any medications? Did you know about her being on any medications?
No, I didn't.
She didn't complain to you and say that she had insomnia and that she was unable to sleep?
And I think the Commonwealth really misses the point that if you are dealing with these intrusive thoughts and you already feel like a bad mom, you are terrified that someone's going to agree with you and take away your children because all of this fear comes from loving your kids so much. It's not that you're a bad mom, it's not anything. It comes from your brain wanting to protect this little human and going into overdrive, and look, I'm not an expertologist. This is how I explained it. You know, your brain goes into overdrive and you either need the tools, whether it be medication or, behavioral therapy to be able to turn off those intrusive thoughts, however that works for you, whether it's a combination of medicine, whether it's no medicine. It's the fact that, you wouldn't share this with the pediatrician. The pediatrician is likely to only notice before these women are on the verge of collapse because all of this fear comes from your child. Something is going to happen to your child. And if you confess to the one person that has the ability to take away your children, you are going to mask harder than you've ever masked at a pediatrician's office.
Difficulty like that?
Not that I can remember.
Did you know that she called the suicide hotline twice towards the end of December?
Objection.
Overruled.
I did not know that.
Okay. Mm-hmm. Did you know that she had been to Mass General Hospital, and then ultimately on New Year's of 2022 into 2023, self-admitted to McLean Mental Institution.
I didn't know that.
So when you saw her on January 24th, you did not know that she had been to McLean Hospital and had been on medications or anything, right?
That's correct.
Because again, she wasn't a complainer.
Correct.
She was a hell of a mother, wasn't she?
I always thought she was a good mom.
Thank you.
Redirect?
No, Your Honor.
All right, thank you, Doctor.
Thank you.
And I am torn very much because before this trial, I would have had no hesitation putting any self-help numbers up, and any number of free organizations that will help you in dark times. I guess my worry now is hearing that Lindsay called 2 of these hotlines and they asked her if she had a concrete plan. My worry is that I'm going to be sending people at a dark time in their life to a place that I thought would give, and I know I'm judging on one thing, but I do worry that I'm sending people who are just holding on to a place that is not gonna be as helpful as they should be. So if you are wondering why I haven't pinned a help, or conversely, if you guys know of a good program, a good number, a good hotline that I can put up, I would be so happy to share that. But what I don't want to share is, something I've randomly looked up online and they have a craptastic track record of actually helping. So if you guys do know of hotlines or, good places to send people who are having a really rough time, I would love to share those out. But what I don't want to do is not be very knowledgeable about where I'm sending you guys to, and then sending you guys to a place that treats you like they treated Lindsay Clancy. So there you go. But if you guys do know one or you come across one, I have wanted to pin one up, but as I've learned more facts in this case, I want to be very smart and make sure that I'm sending anyone who needs help to a caring and compassionate, place. Oh, we're not doing the cross with you. I don't like you. Oh, this is a new one.
And what?
Things working better?
Yes.
I'm going to chill on to.
Oh,
Just step, please.
See his car sitting out there.
hydraulic fluid.
Car's out back.
I'm going to ask you to keep your voice up and speak into that microphone. All right. Attorney Sprague, please.
Thank you. Can you please state and spell your name for the record?
Susan Fraioni.
If you ever need to see how executive function does not work in my brain, I am trying to mute my mic, talk to Mr. Mo, and mute my mic. And as you can see, none of those things happened. So Mr. Mo is off with his best friend and the best man in our wedding to go get hydraulic fluid for the excavator, the mini excavator or hauler thing to to reinforce the hillside that was falling down. I don't know. They're doing manly stuff. But yes, if you ever like to see how my brain does not do, how do I stop this? How do I make this work with technology? That is exactly how. And old Mo would have spiraled. Oh, old Mo would have ended the stream, not gonna lie. But having streamed for several years, it is what it is, and we move on.
SUSANFRAONE,
And your date of birth?
11/26/82.
Where do you work?
Learning Sprouts,
And how long have you been working at Learning Sprouts?
almost 6 years.
What is Learning Sprouts?
Preschool daycare.
What age range of kids attend Learning Sprouts?
15 months to about 5 years.
And what age range do you teach?
The about 3-year-olds to 4-year-olds.
And back in January of 2023, what age range were you focused on
The
teaching?
3-year-old, 4-year-olds.
Was Dawson Clancy in your classroom?
Yes.
When did he start in your classroom?
September of 22.
And did you
The lip smirk. Now, I am not telling you that after 2 weeks I had forgot. Look, I always forget. Eastern Seaboard, I always forget about you and the lip smacks. I do. And look, in my sweetest, most Midwestern way, I gotta say, y'all seem like the loveliest people. And if you could just curtail the lip smack by like 93%, I think I could visit. But right now, I don't think it would be fair, not only for, the bail money I would require, but either my ears and your ability to listen to me complain, for me to take a visit to Boston right now. Holy lip smack. It's not a punctuation. Is there a shortage of water? Someone get these people water, get them hydration tablets, let them have a Werther's.
know Cora Clancy as well?
Yes.
How did you know Cora?
Most of the teachers help out in all the classrooms, so we get to know all the children.
And did you teach Dawson from September of 2022 until you went on maternity leave later on in 2022?
Yes.
Do you remember what month that was in that you went on leave?
November.
Prior to going on leave, so from September to November of 2022, were there any issues with Dawson?
He started having harder drop-offs around mid-October, I would say.
Is that typical for that age, or is that something unusual?
Sometimes, yes. It was a little not typical for Dawson.
So prior to that, he was fine at drop-offs, and then sometime in October, drop-offs became a little harder for him.
Yes.
And did that resolve over time?
Sometimes he would have better drop-offs, other times, but then I went on leave, so.
And after you went on leave, sometime after Thanksgiving of 2022, did you see Lindsay Clancy, Dawson's mother?
Don't really remember. I think I did.
Do you recall having a conversation with Lindsay where she asked you how your baby was and how you were doing?
Yes, we did have a conversation at some point because I was still bringing my oldest daughter to school every day.
Okay. And so you had your child in November, and then this conversation is sometime either around or after Thanksgiving?
Yes.
And when you had this conversation and interaction with Lindsay Clancy, was that at the school?
Yes.
And how was her demeanor?
Fine.
Was it any different than any other time you had seen her?
No.
Did she appear to understand you?
Yes.
Did you have any trouble understanding her?
No.
Okay, legitimately, did they watch like those old black and white legitimately I was going to say old black and white 50s mental health films, but honestly, I think they might have gone back to the Goebbels film filmography about mental health. With the way they are talking about this, so Jen, so the hair is the court clerk has the most awesome, like heart full 80s. She herself is responsible for half of the ozone layer being gone. And I find myself deeply just loving that haircut because I love Heart. She also has the most offensive audio-wise voice to my ears. She has she has the falsetto of a Bee Gee brother without the the backbeat to kind of help it out. So I love her hair, so I just thought I would wear her hair. And then the bow is the opening salvo. This is as tame as it is going to be from now on. Commonwealth, you have officially rendered me in what I like to call chaos crafting goblin mode. You cannot imagine the glee and anticipation with which I am waiting to go to Hobby Lobby. They have bows. I have a hot glue gun and spite. Commonwealth, you have been warned. It is also weird to realize that you look both like because this is the hairdo without the bow. And it is weird to look into your camera and see every Lifetime movie from your childhood ever. Whether it is the Judith Light or Meredith Baxter Burney variety, um, to even Jan Brady. But I'm just saying, ladies of a certain vintage, there is a certain power that comes from knowing that I could take down any suitor, from a lesbian bar to a Whitesnake tribute album, like, concert, um, with one hairstyle. I mean, I'm just saying, I think I understand why Pat Benatar wore this hairstyle out. Like, just OUT out. I am waiting. I am every single Lifetime movie. I am waiting for my, semi-abusive husband to come in and out my eating disorder. Um, that is how I feel when I have this wig on. Or Pat Benatar blonde. Um, and then, like I said, so it is weird to be the reflection of every Lifetime movie you've ever seen, but also at the same time, to be what a healthy, functional adult version of Miley Cyrus would look like. S So I'm having way too long story short, I'm having way too much fun, with this bow and and wig set.
Did you have any concerns about her at that time?
No.
Was that the last time you saw her?
Yes.
And you're a mandated reporter, correct?
Yes.
So if you had seen anything about Dawson's behavior or about the parents' behavior at any point that caused you concern, you would have had to report that, correct?
Yes.
And at no time did you make any reports about the family or the children or the parents?
No.
When you had that conversation with Lindsay Clancy sometime in November of 2022, did she ever say anything about insomnia or not feeling well or being depressed or anything like that?
No.
Thank you.
Yeah. Also, tell me you don't have any girlfriends without telling me you don't have any girlfriends. See, if you had any friends, Commonwealth, you would realize that there are acquaintances and then there are your besties. Now, my besties are going to see like me hysterical. I am going to call them crying because I've reached the end of my rope and I want to throw my computer out the window and they are going to talk me down. Now, my acquaintances, like my kid's preschool teacher, who is a really sweet person, is going to see the me as the most put together version of me as I can scrape together that day. So none of this shocks me. But you can tell the Commonwealth has not engaged in human socialization in ever. So they are confused by all of this. It really is like watching two like alien observers become acquainted with like humanity and how humans work. if we could just do it in a not serious trial.
Cross.
Morning.
So how long did you, in your capacity as a teacher at Learning Sprouts, know the Clancys?
I started at Learning Sprouts in November of 2020, and Cora was in preschool at the time.
Okay. So you obviously saw the kids on a fairly regular basis.
Yes,
And forgive me, what is a drop off? What does that mean? I'm sorry.
when the parents drop the children off at school.
Okay. And when district attorney asked you were there difficult drop offs, what does that mean?
Do you remember that time you turned away Julia Roberts from your fancy boutique on Rodeo Drive? Yeah, and I'll do it again. I said what I said. She shouldn't have shopped there. Also, she can have Richard Gere. I don't want him. I said what I said. She looked like a tramp. We have clientele. It is a business. It is a brand. It is private property. And we are allowed to deny service to whoever the hell we feel like. So, yeah, I am fine. You know what? I tell Julia to get out of my store again.
Sometimes when parents drop the children off, they'll be a little clingy or they cry. Excuse me. Or they cry.
And that would be the child would cry, maybe the
Yes.
parent either. I don't know, but
Sometimes.
so did they have difficult drop offs on occasion? I guess the Dachshund
Yes.
would cry.
Yes.
How would Lindsay react? Was she okay? Did she seem concerned as a parent?
I wasn't seeing as much of Lindsay. I was seeing more of Patrick.
Okay. And Dawson appeared to be healthy and happy and engaged,
Yes.
as well as Cora.
Yes.
Thank you.
Nothing further.
All right, thank you, ma'am. Please sit down. Thank you.
Watch your step, please.
So this would be now today, her hair, or yesterday, her hair was pretty tame, but it reverts back into like full heart, you know, just power ballad early 90s. It goes full heart. It is genetically set and time stamped at that era. She wakes up, she wants to do something different with her hair. It goes right back to this lovely shag. Now it's longer on her, but I'm a fan of her, but her voice makes me want to crawl into the roof.
This way, please. Watch your step, please.
Good morning.
Good morning.
All right, I'm going to ask you to speak into that microphone.
Okay.
All right? And keep your voice up so we can hear you.
Okay.
All right. Come on.
Thank you. Good morning. Could you please tell the jurors your first and last name?
Susan Bertolo.
And if you could just speak as loud as you can into that microphone, okay?
Yep.
Can you spell your last name for the record?
Bertolo.
And what city or town do you live in?
Plymouth, Massachusetts.
And where do you work?
Leaping Frogs Preschool.
Prior to working at Leaping Frogs, did you work at another preschool?
Yes. At
Where was that?
Learning Sprouts in Duxbury.
And how
All
long
right,
had you been?
no. We are employing what I like to commonly do in our catch-up modes, which is we are just going with the defense. Was there no defense cross?
Mr. Reddington.
No questions. Thank you.
All right. Thank you, ma'am. Me sit down.
Thank you.
Thank you.
Oh my God. Diane West and Starker Channing. This woman has obviously watched Practical Magic the same amount of times as I have. I am just guessing because she is of a certain age and she has kept her long hair, which is what I plan to do. Do not expect short hair as I age. I am legitimately in the place in life where I don't ever want to cut my hair ever again. I hate haircuts. They never work out for me well. I would just like to let my hair grow. That being said, this is what my brain does. I see this woman and I'm like, oh my God, she must have watched Practical Magic like 900,000 times like me. and is obviously styling her entire personality on the Diane West and Stockard Channing characters, which is what I plan to do as I grow up. So I have already made all of these assumptions in my head, but it does guarantee that I am like super excited to meet her. And I'm usually not a people person.
Good morning. I'd like you to raise your right hand for the clerk, please.
Good morning. Do you solemnly swear that the testimony, the evidence you shall give
And y'all, see, this is where my love for her dies. This is where my love for her dies, where she assaults my earballs.
to the court, shall be the truth, the whole truth, and nothing but the truth, so help you God. Thank you, ma'am. You may have a seat.
Watch your step, please.
Hey, good morning.
Morning.
I'm going to ask you to speak into that microphone. Keep
Okay.
your voice up. Pull that down a little bit for you. That's it. All right. Counsel.
Thank you. Good morning.
Good morning.
Could you please tell the jurors your first and last name?
Stephanie Williams?
And Williams, that's just common spelling.
Yes.
What city or town do you live in?
I live in Sagamore Beach.
And what do you do for work?
I'm a pre-K teacher
And where do you work?
at Learning Sprouts Children's Center
And where is that located?
in Duxbury.
And how long have you worked for Learning Sprouts?
And this is not as offensive to me as first responders, but it still hits that perfect pitch of ick. Do we really need these particular witnesses? And is the price of the information that we are going to get for them so worth it that we're going to make them go over? These are lovely people. Every single person that I have seen go on screen, um, you know, Magic Mo's, like instant clocking personality brain has all, clock them as really good, giving kind of cool people. So making them relive the fact that they're little students and teachers, good teachers, like these kind of teachers invest so much into their students, and they grieve when a student is lost either because of illness or a tragedy like this, and it's just as gross as bringing the first responders up, if you ask me.
About 6.5 years.
What age group do you teach?
I generally teach the pre-K children, the 4-year-olds that are going to be turning 5 and going to kindergarten.
And at the Learning Sprouts preschool, fair to say that the different rooms are given a name?
Yes.
Okay. And what room did you work in, or do you work in?
Currently, right now, I work in the Sweet Pea classroom. When I first started there, I worked in the orange classroom.
And I'm going to draw your attention to the fall of 2022, September, into January of 2023. Were you in the Sweet Pea room then?
Yes.
And how many people teachers would be in the Sweet Pea room with you?
I was the only teacher in that room.
Yeah, we are kind of moving ahead on some of these. I am reading the closed captions as I kind of speed through.
About anything that was going on in her household at that time?
No.
And you, as a preschool teacher, are a mandated reporter, correct?
Yes, I am.
So if you were to observe...
Okay, so Commonwealth, explain the logic of this to me. A mother is terrified she's going to lose her children. In fact, all of her anxiety seems to be related to the fact that she does not want to go back to work and leave her children. And she is going to confide, expose her worries, her inner dark secrets to someone who she knows, as a nurse, is a fellow mandated reporter. Yeah, I wish that had happened. I wish that, with all the crazy theories that the Commonwealth is putting out and ways that Lindsay should have accurately displayed, insanity or psychosis. Yeah, I wish someone would have picked this up on this and, temporarily removed the children for their own safety. But that is presupposing, that is starting with the supposition that Lindsay, was faking all of this, and I do not get how you can look at her injuries and the fact pattern and get faking as your tactic.
Observe something either on the child or from what the child said or behavior of a parent, you would be required to report that?
Yes, I
And
would.
as far as the Clancy family went, you didn't notice anything and you didn't report anything, did you?
No.
Thank you.
All right.
Tuck in your
Thank
blouse.
you very much.
All right. Thank you, ma'am.
Now, as you can see, this heifer thought she could get away from me. She thought that she would, stop the internet mockery by wearing a tiny bolero tie. And, I was less offended by the whole bow tie thing. Like, I felt a scotch bad about it when I thought it was a tactic to hide her obvious female pattern baldness. Note, woman, bodies don't like evil. If you are an evil cahoot, it's generally going to show. Bodies just don't like that. They're not compatible with cahoot. And I'm saying this half joking, half not, but really the stress and the amount of, I don't know, malice you carry around could be affecting your hair in the hair follicles. That being said, the rage I feel now knowing that these two, but especially this particular prosecutor, decided to vulture, valor, steal steal the fact that Cora loved bows. Instead of doing a competent case, instead of doing less than 10% of a half-assed job on the case that she's supposed to be covering, she has put a lot of effort into those bows. And y'all, the rage that I will be channeling in to making this is just the opening salvo. There is no rage like a rageful, vengeful Mo that can channel anything into crafting. So I have never been more disgusted because, look, as an irreverent, ridiculous person who has spent the greater part of 2 weeks having ever ridiculous, more absurd eyebrows on my forehead, never would it ever cross my mind if I were a professional attorney to do a stunt like this at a case I couldn't care less at. And you can tell they couldn't care less about this case. They can care about the malice and the emotional torture they are inflicting on everyone. But they did not look at the facts of this case. They didn't spend an iota of time strategizing or considering how to put this together. Note their opening statement and the 97 theories of how Lindsay's alternately faking this and then pill shopping, to note that they spent 3 minutes, putting this together. And I find that I have never seen something more disgusting in my entire life than the act of putting on a bow to feign that you are actually giving a shit about a case that you didn't. So, like I said, this is the opening salvo, and most things don't irritate me on a level that I'm motivated to do anything about them other than bitch. But then we give me an opportunity to craft. And the hills are alive with the sound of mocking. My heart wants to sing from the streams that you suck. So, the browse may continue or not. I have a new target and, well, permission I gave myself to buy a bunch of bows and ridiculous crap at Hobby Lobby. So there you go.
Let me step down. Thank you.
Watch your step.
Andrea Hennig.
Sorry, do you solemnly swear that the testimony? Thank you, you may have a
This
seat.
way, please. Watch your step, please. You're on.
morning.
Good morning.
All right. I'm going to ask you to speak into that microphone. Keep your voice up so all the jurors can hear you, okay?
Yes.
All right. Perfect. Ms. Sprague.
Thank you. Good morning. Can you please state and spell your name for the record?
Andrea Hennigan, AndreaHennigan.
And your date of birth?
March 11th, 1976.
What do you do for a living?
I'm a registered nurse.
And where do you work?
Massachusetts General Hospital.
And do you work at any specific department there?
Labor and delivery.
How long have you been a labor and delivery nurse at Mass General?
25 years.
And as part of your training and work in labor and delivery, are you trained in recognizing or helping new mothers who seem to be having issues with postpartum?
Do you mean postpartum depression?
Yes.
I don't have formal training in that area, and I mostly see women before they give birth and immediately afterwards, in the first 2 hours after they give birth. If they come back to the hospital during the postpartum period for a concern, we do screen patients for postpartum depression.
And is that all the nurses that work for the Mass General Hospital labor and delivery?
Now, I believe because I watched a bit ahead, this nurse, Lindsay either talked to her at some point about being tired and very overwhelmed, but or feeling like a zombie. I'm not sure if it's this witness or not, but a lot of these nurses are going to say that Lindsay or these people are going to come up and say that Lindsay was expressing that she was concerned, about some of the things going on inside her head, that she was having a lot of anxiety, that she was, overly tired, that she wasn't sleeping. So rather than, again, the Commonwealth only has really two narratives after all of these witnesses at the end of today. Either Lindsay was so committed to, pulling off this long con that she was able to, go to this, and this person and tell similar stories and symptomologies, or that she was really experiencing this, that it wasn't at all put upon. Oh, well, why would I would expect nothing effing less from the medical establishment complex.
Unit are able to do those great screenings for postpartum depression?
Yes, we ask patients questions about if they're suffering from depression or anxiety, and if they have any feelings of wanting to harm themselves or anyone else. That's a standard.
Now, I'm going to tell you as a professional masker, I could be white knuckling it for my dear life, and there is nothing wrong. This woman seems sweet, and she seems like the perfect woman to be with that calm kind of voice and that kind of really positive voice. She is the perfect person you want on a labor delivery room. But I can tell you as a person, just her tonal quality and that kind of cheerful voice, I probably wouldn't open up to her. And it can be that subtle of a thing. It can be that, like, I could be ready and open to, because everything else about her seems very comforting, opening, and warm. And again, this is the irrational part of masking, in that it doesn't always work for us, and it works against us. But just by, like, the cheer in her voice, I am terribly worried that, that she's not gonna understand the depth of the darkness that I feel like I'm dealing with here. And, the thought of having to explain what I'm going through and have it possibly be misunderstood, is exhausting. At once exhausting, but also terrifying when you're in a place where you don't even know what your brain is doing, anyway. So, while it would have been the best thing for Lindsay to have, training or no, told everyone deep down what was going on with her so she could have gotten the attention and help. Hopefully, if we lived in a perfect world. It's not always something we do consciously, and it can be something as silly, as insignificant as, um, "This person's voice is too cheerful. I do not feel safe around them." That mask goes up. And even if I wanted to scream, even if I wanted to shout that I'm really struggling here, um, that mask has been such a protection from my brain that it's not going to let me. Eh, so I say this as a person that not as pity because again, I didn't realize all of this until, in the past couple months when I've been trying to figure things out. So I say this as a person who is realizing I do this, and did not realize the extent that I did this on a subconscious level. So imagine when you are, feeling out of control, out of touch with reality. It can be something as small as someone's voice sounding too cheerful that will stop you from saying anything and getting help. And I'm not a genius. I'm not a doctor. I don't know. That's why I'm going to see one of those people to try to get the tools that when I need to unmask because, I need to have someone help me work out my feelings. How do I get through the discomfort and the automatic mask shutdown that my brain will attempt to do? So this is not any judgment on her. There is a lot of judgment on the fact that she wasn't trained in any of this. But I do wanna kind of give you a little bit of a micro snapshot into what it might look like if you are a subconscious masker like I was for a long time, and I'm realizing that in the same situation, I would not have opened up to this woman at all. And trying to give that perspective if all of this is kind of confusing to you and you don't live the life where you are dealing with chronic pain and everyone masks to a certain extent, but you don't get the inner kind of chess play that goes on with all of this and how so much of this is subconscious and kind of beyond what we are really logicking or being intentional about.
Standard admission question.
And if these patients respond that yes, they are having issues with depression, anxiety, or wanting to harm themselves or others, what do you do with those patients? Do you refer them somewhere, or do you give them materials? What do you do?
Well, we would talk more about their symptoms with them, and then the first step would probably to be alert the provider who's caring for them, either the doctor or the nurse midwife in our setting, and get social work involved.
Now, while you were working at Mass General Hospital, did you work with Lindsay Clancy?
Yes, I did.
How long did you work with her?
The whole time she worked on our unit, which I believe was 7 years.
And so when you say our unit, she also worked in labor and delivery with you, is that correct?
Yes.
And in addition to seeing her at work, would you also socialize with her occasionally outside of work?
Occasionally, yes.
Directing your attention to after Ms. Clancy gave birth to Callan, which May of 2022, so after May of 2022, did you reach out to her, talk to her in any way?
Yes, I saw Lindsay twice from when Callan was born until January. I saw her in June and in November, and we would send each other text messages.
When you saw her in June, where was that?
That was at her home. I brought some lunch for her and visited with her and the baby, and Patrick and Dawson were home.
And how was Lindsay's demeanor during that visit?
Very good.
Was she her typical self?
Yes.
And how long was that visit for, approximately?
Maybe 2 hours or something like that.
And you said the next time you saw her was in November of 2022, is that correct?
Correct.
And where was that?
It was a restaurant in Hingham. We met for lunch.
And when you met with her for lunch in November of 2022, did Miss Clancy talk to you about some issues she was having with sleep and anxiety?
Yes, she did.
What did she tell you about that?
During the lunch specifically, I don't remember her exact symptoms. Our conversation surrounded her upcoming return to work, and Lindsay was feeling that she wasn't in a mental state ready to go and take care of patients. She talked about insomnia and some not feeling herself. I believe she might have used the words like brain fog or something like that.
And while you were having lunch with her and having this discussion, did you ever have any trouble understanding what she was saying?
No.
Did she ever appear to have?
You cannot dislike the Commonwealth enough. But was she slurring her words? I mean, did she point out the unicorn in the room? I mean, well, there you have it, America, not Looney Tunes. At this point, I said facetiously, was there research solely from pre-1940s Germany about mental health? I mean, because even mid-50s mental health films were more respectful than the caricature of mental health that the Commonwealth is putting on.
Difficulty understanding what you were saying in response?
No.
Was there anything different about her speech pattern?
Not that I recall.
When you were discussing these issues with Lindsay about having some insomnia and being concerned about going back to work, did you give her any advice or do anything to help?
Yes, it was myself and two other nurses that we work with who Lindsay was friends with outside of work, and we were all encouraging her to get the help and support that she needed with medication if needed and therapists, and giving her any ideas we could think of in our personal and professional lives that may help her.
Okay. And did Lindsay tell you that she was looking to find some type of medication that would help her sleep and help her with her anxiety?
Yes, I believe we talked about medication, and she was going to be meeting with a new therapist shortly.
And during this conversation or after it happened, did you ever have any concerns about her harming herself?
No.
Did you ever have any concerns about her harming the children?
No.
Did you give her some names of obstetrics or social workers?
I did. After our lunch, I recall that I reached out to another friend of mine who had a pregnancy loss that was challenging for her and had met with obstetrical specific social workers and support groups, and I asked that woman, could you share those names, and I sent them to Lindsay.
Okay.
Now, we have done a lot of dogging on the medical industrial complex, but thank goodness they have, social workers, and specifically for women with that experience loss on the maternity wing. My third daughter had to go directly to the NICU, and I still got blessed that I got to go home with my little girl eventually. But there is a particular hell at being on a postpartum floor and not having your baby with you. So I am glad in the years that have gone since, and I didn't even know the full hell of that experience, but just the couple of days of listening to little babies cry and all of that without having your little baby in the room with you. Thank goodness that there are good and that's the sad part. The sad part is that there are tons of good nurses and support staff and and social workers who work in these very niche areas to help people that are worth solid gold, that are the living heartbeat of the true call of medicine to cure the whole person. And then you have stories like this. So as much as we have dogged on that, I do want to highlight um, that while I've never walked through that particular hell, there are so many really, really good boots on the ground people that have been there for me and my family members at really, really rough times. So yeah, there are jerks and the whole system kind of sucks balls, but there are also really, really good nurses and doctors and support staff out there who are trying to fight back and do better. And I think sometimes, especially in this trial, I know I have, I tend to forget that, yeah, there are doctors that don't pay attention, but just like that, there are doctors who have dedicated, their lives, like Dr. Indiana Bones from the Hernandez and Tim's trial. For every Dr. Mesner, there's a Dr. Bones, and there's probably a bunch of other Dr. Boneses that don't get to share their adventures on trials.
Did you have some text messages between yourself and Lindsay around Thanksgiving of 2022 in which she told you about a program she was going to try?
We did have text messages around Thanksgiving. I believe the program you're referring to was something that her mother-in-law had told her about at South Shore Hospital that was more specific to perinatal issues rather than a general social worker, someone who specialized in this area.
What does perinatal mean?
During pregnancy, birth, and after birth.
So this was a program more focused on women either during their pregnancy, while birth, during birth, or right after birth, as far as you know?
I mean, as far as I understood it, I just understood it to mean someone who was familiar more with postpartum depression or anxiety was my understanding.
Okay. And did you also receive some text messages from Lindsay Clancy right after New Year's on January 2nd, 2023?
Yes, I did.
And can you tell us what that exchange was?
Again, that was with myself and Lindsay and the two other nurses who she had confided in. And we asked her how her holidays were and could we get together again in the new year. And she said, I can't get together right now because I'm involved in an intensive program, but hopefully soon.
Okay. And did she wish you a happy new year?
She may have, I do not recall.
And did she tell you that she was in fact at that time at McLean Hospital, or did she just leave it more vague that it was just an intense program?
I believe it was an intense program. I did not know the name of the facility at that time.
Did you at that time know that she was currently at a hospital?
I don't recall what I knew then versus what I know now.
I like that answer.
Did you also speak with Lindsay on January 23rd, 2023?
I did not speak to Lindsay. I sent her a text message on January 23rd.
And what did you say in your text message?
I'm paraphrasing, but I believe I said, hi, I've been thinking of you, wondering if you're still in the daily program, I believe I said. So maybe I didn't realize it was inpatient. And she responded.
And what was her response?
Again, I'm paraphrasing, but she said something like, I'm no longer in the program. I'm continuing to work with my psychiatrists to find the right medication that will allow me to sleep at night but still function during the day. I've had a lot of bad or negative side effects from the medication, so I've had to come off of them and go on new ones, and it's been very difficult.
Okay.
Or has taken.
Legal tubes, I believe it is $8.99. I put obnoxious bow, and then I like headbands better, just because I can put them over a bunch of wigs. So, um, I just put obnoxious hair bow in on Amazon and then pick the ones that could be shipped, next day, and this is what popped up. I believe it's $8.99. Now, I also have these 2, which, Amazon, can we talk about size teasing? Because I was assuming that I was getting more bows, but this is why I need to go to Hobby Lobby. These are obviously not going to cut it. We need to fully ridiculate these headbands. So I have a Hobby Lobby mission this weekend, but basically Amazon. They have a lot. I was trying to keep myself in a very tight budget. So I just picked 3, but they have scoodles of them, and I need to win the lottery.
Taken a long time or something like that.
Okay. And after those text messages that were exchanged on the 23rd, did you have any concerns that she was going to harm herself?
No.
The tone of the text messages, were they more positive and hopeful that things were going to work out on the right medications?
I don't know that they were more positive than previous times. I believe that Lindsay was always hopeful that she would get the care that she was seeking. So I don't know that the tone was different that day.
But it wasn't a negative tone. It was that same kind of hopeful tone.
Yes, as far as I remember.
Okay. Thank you.
Thank you.
Attorney Reddington.
Morning.
Good morning.
So even during the, let's say, the difficult times that she had, she was always trying to be hopeful and always tried to have a positive outlook on her health.
That was my impression, yes.
And you obviously are a good friend.
Yes, I believe so.
And you've known her for what, 7 years? 9 years now, right?
Yes, I believe.
No, Amazon. But I am going to be going to Hobby Lobby to see if there are ways that we can, Emerald Lagasse bam it up just a bit. Because this is just, the rage I feel that the Commonwealth is putting on such a craptastic case and then saying they are honoring the victim by wearing a bow. The absolute audacity of that statement is so utterly mind-blowing that I can do nothing. JKD Buck, I would. And I blame the wig. I blame the wig because I need to show you something. There is an unearned level of ego that I am feeling, knowing I could go to my local state fair, lesbian bar, and a Whitesnake tribute concert and pick out any suitor, male or female, and take them home tonight. I'm not saying I'm gonna win my state fair, but Charlene better watch out. So I sure as hell. Besides, I mean, I might be mistaken for a fully functional, healthy Miley Cyrus. I mean, people will come up to me and I will of course go along with it. I only have one problem because I love this era. I love Heart, I love Barracuda, I love everything about it except for the blue eyeshadow. Who decided this was a good look? Legitimately, will someone from the time period come to me and explain to me why? Because with blue eyes, it simply looks I look ridiculous. I don't get it. I feel like Mimi from Drew Carey. But there you have it. I love the 70s for the hair, hate it for the eyeshadow.
Since 2015, if that's when she began working at Mass General.
Right. So she was like a 24-year-old kid when she first started there, right?
Yes.
And you basically knew her right out of nursing school, all the way up through
Yes.
till she finally had the last baby, right? Can you tell us, what was her work ethic? Was she a good nurse? Was she a caring nurse? Tell us what your observations were. Granted that you're
It's also super weird because I am naturally about, I would say, a tone or shade darker than this. So this is my natural hair color, you guys. And I believe with my complexion, there is a reason I don't go for it because it totally washes me out. That being said, I did send a picture to my mother because she is always a fan of me in the blonde wigs. She's like, "Oh my God, see, this is what you would look like if you were normal." You know that, meme where it's like, "Would you just be normal?" and the kid's screaming in the background? That has been my mom my entire life with me. So I do get that I played a part in her insanity defense. Um, but she's always so disappointed when I wear these wigs because she loves me as a blonde. I think that's because she spent, I'm gonna damn near round up $2 million, trying to achieve this color that God gave me that I don't like, so I dye it darker. The things that I, that give me a giggle that no one else, the fact that my mother has spent, I don't even wanna calculate the money to achieve the hair color that I got naturally, and I was like, "Ew." Those are one of just the little paradoxes in life that make me giggle all the time.
a friend and you might be biased, but tell us what you thought.
Yes. Lindsay loved being a nurse and was excellent at it. It was a second degree for her to go to nursing school. And you could tell with Lindsay, it was more of a calling that she really cared so deeply, specifically about caring for pregnant women and women giving birth. She was very attentive to all of her patients' needs. She was very smart, and mostly she was incredibly nurturing and caring.
Thank you. And during the period of time in the fall of 2022 up through Thanksgiving of 22 and then into 23, you obviously, as a good friend, stayed in close contact with her, texting, seeing her, dinner, lunches, and everything, right?
Yes.
And then when you and some of the other nurses would go to a lunch, for example, if I understand.
I've also learned the meaning of Christmas, and I saved the Grinch, all in a day's work. I mean, I can go from, okay, this is why a good wig is so great, because with just a little bit, a single wig, a single mullet wig, might I add you, I can go from every single Lifetime movie you have ever seen with Meredith Baxter Birney or Judith Light, or I can, be Pat Benatar if she were a blonde, or what is that? Oh God, what was the name? Billie Jane? No, Billie Jean. Was that the movie with the Pat Benatar single and the chick that cut her hair like this? Because I love that movie. Uh, but then you add a bow and you've saved the Grinch and Christmas. Where are you, Christmas? Why can't I find you? Oh, I'm on Twitter. That is why. And if you're me and a little bit weird, you can have all this fun by yourself at home in your own room. It's like the best thing ever. I'm not saying that wig therapy is a thing that I will be writing about, but I have crayons and I'm going to write me a memoir one way or the other.
Correctly, one of the luncheons that you had in the fall of 22, she was telling or sharing with you the fact that she was going through a difficult period.
Yes.
Told you that she was not in a good mental state, that she had a lot of insomnia, and she even described it as brain fog, right?
Yes, I believe so. She definitely used those words in our text messages, as the fall progressed, but I believe she used those words during the lunch. She definitely said that she was in a difficult mental place and didn't think she'd be able to go back to work.
And she told you that she was actually actively treating with medical personnel. Did she say a psychiatrist, psychologist, or just seeing doctors, or what did she say?
Yes, she talked about therapists. She talked about going on medication. At some point in that month of November, she said she had even gone to the emergency department.
Did she tell you that she was having negative side effects with the medication that she had been prescribed by these doctors?
She did. She did not elaborate on the side effects, but she did say that multiple times.
So as close as you were for all those years working together, and you guys worked together through the COVID too, right?
Yes.
Is that a bonding experience for nurses?
Yes.
During that period of time, did you ever observe her? Was she a complainer? Like, would she come and complain to you, or was she pretty much private but would share her opinions of what was happening inside of her with you?
She was not a complainer about work or home or anything, but we were friends, and she did share more personal details with me.
And when she was working, would you guys be working on the night shift, or would you work in the afternoon, or
the night shift?
Night shift. Mm-hmm. So did you ever see her go on her phone and access cameras to see what was going on at home with the babies or anything like that?
Yes.
Is that something that she would do on a regular basis, staying in touch with the family and looking at the cameras?
Yes.
Did she ever tell you why she was doing that?
Not specifically.
Okay. She, to your appearance or to your observation, appeared to be very concerned about her kids, right?
Yes.
Did you ever hear her complain that she wanted to leave behind the life that she had and basically move on something better?
Oh, no.
Now, this is the part that really is the most confusing aspect of the Commonwealth's sort of opening statement and kind of their idea of the case. They said that they were going to prove that Lindsay was, a mom who was looking for an out, a woman who, had tried the mom life and decided it wasn't for her. So rather than leaving her husband, which you think would be the easiest way if you just simply didn't want this life you were leading anymore, she decided to go on this like almost year-long, mental health farce, and then just I can, but I am planning a Hobby Lobby trip. This is only an opening salvo in how the bow wars are going to go. So yes, I will wear just a bow one day. Just going to come in one of those big car bows, strategically placed. Okay, probably two of them. Look, we're going for modest, full bow modesty coverage, so there might be several bows, but don't tempt me, Commonwealth. Like, there are no levels. I am okay going out in public like this. Like, you have no idea what you have unleashed. The levels of shenanigans that are going to happen in mockery. This is my opening salvo. Commonwealth. Oh, I hope you have aloe, because I'm gonna slay. And I mean that fashionably and figuratively for the internet and idiots.
Lindsay, from the time I met her as a young woman, very much desired to be a mother and have a family.
And she did share with you that her mother-in-law actually referred her to somebody for some help as well, correct?
Yes.
In the holiday period, you guys stayed in touch again. You were texting her, and that's when she was, now we know she was in McLean Hospital, but she told you she was in an intensive program, right?
Correct.
In other words, she didn't say, I can't go to lunch with you guys because I'm in a mental hospital. She basically said, I'm treating my problems.
Correct.
To your years of dealing with Lindsay and seeing her with her kids and her family, what's your opinion of her as a mother?
Lindsay was a very loving, caring mother. This is exactly what she wanted to have. She wanted a big family. She was happy to have her children close in age.
Thank you.
Thank you.
The redirect?
No, Your Honor.
All right. Thank you, ma'am.
Thank you.
Watch your step, please.
All of us?
Good morning. Do you solemnly swear that the testimony in the evidence you shall give to the court, which are the matter now, will be on the law, and shall be true and whole. You may have a seat.
Watch your step, please.
All right. Good morning.
Good morning.
Counsel?
Thank you. Can you please state and spell your name for the record?
Bethany DeColibus, BETHANY DECOLLIBUS.
And your date of birth?
6.
I'm glad you spelled that out, because that if that had been on a paper for me, I would never have guessed Decolibus. I would have said not that. So
2989.
What do you do for work?
I'm a licensed marriage and family therapist.
And do you have your own practice?
I do have a private practice.
How long have you been in this line of work?
I've had the private practice for about 6 years, but I've been licensed for close to 12.
And in your practice, do you do in-person therapy or telehealth therapy?
I do telehealth therapy right now.
Do you know Lindsay Clancy?
I do.
How do you know her?
We were friends, met as new moms in the same town.
Would that be Duxbury?
Yes.
And how often would you see her?
I'd say probably weekly.
And where would that occur?
Our kids were.
I don't know, but she keeps smacking her lips, and so my brain has lost all remembrance of her name. You know, if she were, Haley Joel Osment could do worse as an impersonator. I mean, because she's making him look good. Her lip. Okay, we're gonna try to give her a chance, but her lip smacks are hurting me.
We're involved in similar activities, music classes, gymnastics classes. We'd schedule play dates.
What was her typical demeanor?
She was active, engaged, friendly.
Did you ever notice any distinctive changes in her rate of speech or the way she spoke?
No.
Did you ever see...
JKD Buck, you know what you have to do. We need the sixth sense. Or no, the seventh sense. I sense dumb people. They don't know that they're dumb. They walk around and they're dumb little dumb. I have always felt like this. Haley Joel Osment, I always knew you were my favorite actor. And if Happy Gilmore 2 didn't prove that, then I don't know what will.
Any extreme changes in energy or weird behavior?
No changes in weird behavior, but I did notice that she appeared more tired.
I'm sorry, I didn't do that.
Could you repeat that?
You could state that again.
Oh, I was answering the second part of your question. I didn't notice any changes in behavior, but I did notice her appearing more tired over time.
And was that after she had Callan or before that?
Afterwards.
And how often would you see her after she had Callan?
Weekly.
So still going to the same types of places where you would run into her and engage with her. Is that correct?
Yes.
And other than seeming more tired, was there any other change in her demeanor or personality or behavior?
No.
Did she tell you during that time that she was having trouble sleeping?
Yes.
And did she give you any specifics on that?
Just that it was very difficult to get sleep, difficult to fall asleep even when kids were asleep, and that it was an ongoing struggle.
Did that cause concern for you at that point?
I think for a period of time, it felt normal, but after it seemed to continue and not let up for her, I definitely worried about her and was concerned.
When you say it seemed normal, what do you mean by that at first?
Again, tell me you don't have children when you don't have children, but, newborns are not a fount of well rest. No, you will never be as tired as you are and as, you are when you first have a newborn. You are just exhausted. The only thing that comes close is having a newborn puppy, like, or you bringing a puppy home and you're trying to, uh, you're realizing that they have teeny tiny bladders and they can't make it through the entire night. So you need to get up every couple hours to take them out. And that does not make for a restful, restorative sleep. So there is a certain level of normal kind of fatigue, brain fog that you would expect for new parents. And as much as I make fun of the, medical industrial complex, these signs can be incredibly subtle. What is the line between new parent fatigue and the start of, pre-psychotic insomnia? So as much as I've been kind of, pooing on the medical profession on a whole, I am not without the perspective that these are very subtle things to kind of watch and progress. And it's not like a neon sign where someone's going to come in and say, oh, they're going to be masking, but, these subtle signs are going to give you the clues that say depression. But when someone is telling you actively that these things are not helping and you continue on the same course of treatment, that requires scorn.
I would say for a period of time seemed reminiscent of, sleep troubles that, I remember having and that, remember friends talking about. But I think over time, I started to worry more and realize that it wasn't improving for her.
And what you're talking about, is it, typically after having a baby, new moms are tired from, late night feedings and changings and all of that?
Yes.
And then with Lindsay, she stayed tired?
Yes.
Okay. Did she talk to you about seeking out help from doctors?
She did.
And did she talk to you about seeking out medication to help?
Yes.
And do you recall any specifics about those conversations, about what types of doctors or what types of medication she was seeking?
I don't know about the different types of doctors or the types of medications.
Did you ever talk to her and she relayed that she was looking to find a therapist?
Yes.
Okay. And do you know if she ever found a therapist?
At some point, it did sound like she had found a provider to work with.
Being a therapist yourself, did you ever offer to give some referrals or anything like that? Or did she ask for any?
I can't remember.
And you said that she continued to appear tired, correct?
Yes.
But other than appearing tired, as the weeks went by, did you observe her and having any problem interacting with people or doing the typical behaviors that you would do at the events you would usually see her at?
No.
Did she appear to have any trouble doing day-to-day tasks or interacting with anyone?
Not that I saw.
Did she ever tell you that she was depressed or suicidal?
No.
Did she ever tell you that she had thoughts of harming anyone else?
No.
Did her physical appearance change in any way?
The only thing I would say in that is that, they might be under different insurances or, there are people who I'm friends with, and then, I kind of like a semi-indifferent person if I'm going to speak about feelings, at the start of things, not indifferent that they're not paying attention, but more that they let me vomit out my feelings, and then they ask me questions, in an, interrogative sort of manner to try to help me come to, a way to organize my Jackson Pollock feelings. So, there might be a certain level, but it does seem kind of odd that, she wouldn't have asked for a referral unless she was. Yeah, that's not really good, although I would say that I don't know that I would want my friends to know how bad things were getting for me, but if I had a friend that had access to good therapists and ones that they would think would work for me, I would in no way turn that down, especially if I was in a place where I was getting scared. So, yeah, Samantha, that doesn't add up, to me as much, and I do wonder if the defense is going to maybe clear that up because of all the things, that's the first thing that, has really kind of not added up on the Lindsay or the defense side.
Way
Not that I noticed.
when you would engage with her, have conversations with her, were they usually in person or text or both?
It was a mix of both.
And did you ever have trouble understanding her, either in person or in a text?
No.
Did she ever appear to have trouble understanding you?
No.
At some point in time, did you have dinner with Lindsay and a woman named Erin Renault sometime in November?
Yes.
And was that something that the three of you typically did?
Yes.
How often would you do that?
Probably once every couple of months.
Was this the first time you'd done that since Callan was born?
I can't remember.
Okay. And what was Lindsay's demeanor during that dinner?
She was engaged in conversation with us.
Do you recall saying previously that she seemed normal?
No.
You don't recall saying that?
Not specifically, no.
What about her speech pattern? Was there anything different about her speech pattern?
No.
What did you guys talk about during that dinner?
I remember catching up as we usually did, giving each other updates on, what our kids had been up to, what our families had been up to. And I also made it a point to check in with her about how her sleep was and how she had been feeling lately.
And did she give you responses to those questions?
She did.
Did they make sense?
The responses made sense.
Yeah. What was the tone of this conversation?
I'm not sure how to answer that question.
Well, when you're asking her about how things are going with her sleep and other things, and she's responding, does she seem negative and depressed about things? Does she seem hopeful about things? Like what's the tone?
It was a serious conversation. I was concerned and wanted to check in. It had sounded like she had been able to connect with some providers. And I would say at that point, I remember her expressing feeling hopeful about the possibility that things could start to get better.
And during this conversation at dinner, did she ever mention that she had suicidal thoughts?
No.
Did she ever mention that she had homicidal thoughts?
No.
Did she ever tell you that she was hearing voices?
No.
Did she ever tell you that she was having intrusive thoughts of her own?
No.
At any point in time while you're engaging with her, did it look like she was responding to something internally, like a voice, or seeing something that wasn't there?
No.
mention any other issues that she was having?
She mentioned feeling anxious.
And after this dinner, did you next see her at Cora's birthday party in January?
Yes.
And at that birthday party, did you see her interacting with other people and parents and children, as a mom would usually do at a birthday party?
Yes,
Did you interact with her yourself?
I did.
Did you notice anything different about her demeanor or her behavior at that party?
No.
Did you have a conversation with her briefly about sleep?
I did.
And was it you basically asking how the sleep issue was going?
Yes.
And what was her response?
She responded that things haven't gotten any better and that she feels like a zombie.
Was there anything about her appearance or the way she was interacting or behaving that when you saw her, you thought she looks like a zombie?
Am I in reality right now? I have to hear Commonwealth, Commonwealth, Commonwealth. Commonwealth. Did you expect her to outwardly manifest Pennywise? What in the I have to go back. This has to be okay. I have to see this.
Demeanor or her behavior at that party?
No.
Did you have a conversation with her briefly about sleep?
I did.
And was it you basically asking how the sleep issue was going?
Yes.
And what was her response?
She responded that things haven't gotten any better and that she feels like a zombie.
Was there anything about her appearance or the way she was interacting or behaving that when you saw her, you thought she looks like a zombie?
She seemed tired.
But there's a difference between being tired and looking like a zombie, right?
She didn't look like it.
All right, that's it. Architect in the Matrix, we need to have a talk. This simulation has gone to farcical levels, and if you want us to continue being bio batteries for your ridiculous animatronic asses, you're going to need to come down and fix this part of the Matrix. Look, there is entirely too much stupid in the Matrix here lately, and people are going to start waking up. And don't say I never did anything for our, mechanical overlords, because I'm trying to tell you, if you don't want to deal with a bunch of us, weird looking Neos, from, oh God, what was it? Zion, you're going to need to come down here and fix the stupids. I'm going to need you to get, I'm going to need you to get Agent Smith, because I have no words. I have no words. And JKD Buck, and while this is so incredibly hysterically funny on one end, it's so incredibly heartbreaking that this is how people think you have to perform to have any mental health struggles. And JKD Buck shares, okay, my best friend in this world, best man at my wedding, tried 3 times in high school to delete. Outwardly, he just looked tired. Inside, he was dying. Yeah, that's the thing. It doesn't have to manifest in these weird poltergeist kind of ways. It can be just tired. It can look just tired.
A zombie, no.
And she was able to engage with you and the other parents there, engage with her children and the other children, correct?
She was.
No. Commonwealth, we are going full Helga Pataki over here. If you guys grew up in the 90s like me and you loved Hey Arnold, then we remember our lovable, our intelligent, our slightly scary leader and famous feminist hero, Helga Pataki. And Helga Pataki is about to go absolute apeshit on the Commonwealth. Because what in the name of Jesus? Well, was she I mean, dear Lord Commonwealth, I mean, I am surprised you haven't called out of state 5150 in on me. I mean, the fact that I actually do look like Cindy Lou Who could be an outward manifestation of my coping mechanisms. So well spotted. You've actually gotten one right this entire trial. What in the hell am I listening to? What am I being forced to watch? As a juror, I would be at this point standing up and telling the judge that I cannot be a party to this trial. This Commonwealth prosecutor has just said that she was not in fact cosplaying as an extra in the Thriller video, therefore no mental health.
And do you recall stating previously that at the party she seemed fine?
And no, not specifically.
Page 11. Just have you look at page 11 and bottom line 24, and then to the top of page 12.
I have never seen anyone wear a velour jacket to their own humiliation ritual, but this is an interesting thing. What I will tell is public humiliation and velour do not mix well with each other. You are going to be incredibly hot. There's going to be that one little a-hole bead of sweat that's going to roll down your spine into your butt crack. So if you are going to go humiliate yourself, wear something comfortable. That breeze polyester velour would not be my first pick. But other than that, Commonwealth, as Sun Tzu would say, get on with it. I'm kind of here waiting with popcorn to see this. I'm paraphrasing just a little bit.
Does that refresh your memory as to a conversation you had with the police back in 2023 where
Now, Commonwealth, let me explain to you what this woman, hair body language, just did right there. Now, I have not watched ahead. I have not watched this woman's response, but I do believe that the Commonwealth is getting ready to experience a verbal smackdown. Let's see if I'm right. Because if you've seen this woman's face, she went from paying attention to the fuck you say, and I am always here for the parts in the trial where the witness goes in the fuck you say mode. When it's warranted, I especially love it.
you said that she seemed fine at the party?
Sure. Yeah.
I have no other questions. Thank you.
Springton.
So, Money.
Morning.
Fair to say that you were obviously pretty good friends with Lindsay?
Yes.
And fair to say that in that regard, you had occasion to observe objectively things like she looked tired, she was complaining that she was tired.
Yes.
Said that she was anxious.
Yes.
Told you that at one point towards the end of time frame into January that she felt like a zombie. Correct?
Yes.
Did you ask her any questions like the district attorney was asking you? Did you ask her, well, what are your symptoms and what do you feel like? And what do you, is there anything that you can tell me about how you feel? Did you probe in that regard?
I don't remember probing about specific symptoms, no.
So in other words, you're friends and you and Erin and Lindsay were out to dinner or lunch and you're trying to have a good time, right?
Yes.
How was she as a mother to your observations? Did she, as far as taking care of her kids, being happy with the kids? Did she not like her kids? What were your observations?
She loved her kids. She was warm, kind, consistent, loving.
And you actually were summoned to be here today by the district attorney's office, correct?
I was.
And you actually were interviewed by the state police. That's what she was questioning you about, page 11 and page 12. It was a recorded interview.
Yeah, and as someone who is a mental health professional, she might realize that Lindsay might not need a professional, clinician in this moment. She was reaching out to her as a friend. So there's going to be entirely different questions that are going to be asked as a friend versus a clinician. And if she is under the care of another clinician, overstepping those professional boundaries and opining on another doctor's, care, uh, could be professionally dangerous, you know, if Lindsay were to act and there were negative consequences. So there are a lot of things that would stop her from, doing a lot of these probing things, not not just because, wasn't concerned or she wasn't caring. Maybe in that moment, she observed the situation and realized that Lindsay needed more of a friend than a clinician. And there was probably also that, feeling that there was that safety net that she didn't have to be the clinician for Lindsay, that in this, situation, there there was already a safety net for Lindsay, and, you know, if they were she was hoping that they were noticing the same thing she was and dealing with it as a clinician. So there would be even double incentive to approach Lindsay as a friend rather than in any sort of professional capacity.
You and things of that nature, right?
Yes.
Would you agree with me that although she may not have been telling you that she was seeing something that wasn't there, or hearing voices, or drooling, or acting in some unusual fashion while you guys were out having lunch, she did express to you that she was having some difficulties, correct?
She expressed that she was having difficulty, yes.
And would you say, knowing Lindsay as you did, that she was a type that was not really a complainer? She would not try to be a downer when you're out to lunch and having a good time with your friends and complain about her symptoms.
No.
But she did tell you that she was somewhat hopeful because she was seeing healthcare providers.
Yes.
And one of the things that they had asked you about, fair to say that when you talked to the police, you told them that you had spent a lot of time chatting about over this period of time that she had been having a lot of trouble sleeping, and that she referenced the postpartum period, right?
Yes.
And when you were talking to the police, the troopers, did they try to divert you? Did you feel that they were trying to get what your observations were, or did they want you to focus on their questions when they were questioning you?
Could you repeat?
No, it's a bad question. Never mind. It's a bad question. I'm sorry. But nevertheless, you actually told them that you had been in touch with her. You'd been to the house, right?
I had been in touch with her, yes.
Yeah, and you knew Patrick.
Yes.
Other than socializing with your friends and with Erin and going out to lunches, you guys would also text, correct?
Yes.
And that's a way of keeping touch with each other.
Yes.
And she would respond to your inquiries about fun things and about kids, right?
Yes.
But also, on occasion, you were concerned about her and you'd ask her how she's doing, right?
Yes.
And when you would ask her those things, she would tell you, for example, that she didn't know what medications were doing to her, but she in fact mentioned to you that the medications did not appear as though they were helping, and she still wasn't able to get any sleep.
Correct.
And further, in the statements that you gave to the police when they were asking you questions about your observations, she did indicate on a couple of occasions that she had obtained a therapist and a prescriber, and she would reference her relationship with Pat and tell you that Pat's great, things like that, right?
Yes.
You said yes. I'm sorry, the door closed. So in those occasions.
And thanks for becoming a member, Snipe Hunter. And I think you might just be renewing it. I think I've seen your name before, so thanks for renewing, and glad to have you back in the Church of Mo. I don't know. The Commonwealth their narrative kind of idea of what happened in this case has been so alarmingly devoid of reality that they almost need to be on a psych watch. I mean, if you have all the facts in this case, legitimately, if you have all these facts in the case and you came up with what the Commonwealth came up with, that she was a terrible woman who wanted to be a single lady again, w w wouldn't you kinda question whether there needed to be maybe a neuropsych test done on the Commonwealth? I mean, I'm sitting here wondering if anyone has thought of this, but they are making a better case for insanity, um, for themselves, with the case they are bringing up and how they are arguing it. Like I said, architect, we're gonna start waking up from the matrix if you don't come fix things down here.
Did she ever complain about Pat, or would they seem to be getting along pretty good?
They seem to be getting along great.
It's Pat.
Was he supportive
It's
to your
Pat.
observations of her?
Pat.
Yes.
Then when you went out to the other dinner, did you indicate to the police that in that conversation that her mother knows everything, or she told you my mom knows everything, and she's working it out as far as the therapist and the drugs, correct?
Yes.
And you still felt that it was readily apparent that she was struggling, right?
Yes.
Still having difficulty sleeping and being anxious, right?
Yes.
And as a friend, you were concerned, right?
I was concerned. Yes.
Now, one of the questions the DA had asked you is that she was supposed to go back to work, and that she indicated that she had canceled that date to go back to work because she still wasn't sleeping well. Is that right?
She had, yes.
And those were her words, that she canceled going back to work because she still wasn't sleeping well.
Yes.
Did she ever talk to you about work? Did she seem to like her job as a labor and delivery nurse?
She loved it as far as I knew.
And then you were at Cora's birthday party in January, is that correct?
Yes.
And that was the one that was at the trampoline park, right?
Yes.
And it was that time, and that would have been in January of 23, I believe, that it was in that time that you were concerned and you said, hey, are you getting any sleep? And she was like, no, I feel like a zombie, is what her words were, correct?
Yes.
Is that the last time you saw her?
Yes.
Thank you.
Any redirect?
No, Your Honor.
All right, thank you.
I do wonder why neither of the sides, since she is more to the mental health part of this, I know they're both going to have disparate experts on each side that are probably going to beat the mental health subject like a dead horse. But I think for the defense, anytime that they can ask someone with any medical sort of skills of any kind, um, you know, does a person have to display all the symptoms of a disease in order to be diagnosed? Because, you know, unfortunately, we've seen in the last week what one psychiatric break looks like live and in color. Um, and thank goodness that, you know, that person is getting help, but breakdowns are not going to look the same. None of this is going to look the same, and I do wish that the defense would put in that, and maybe they are reading the room, maybe they are seeing the looks of disgust on the jury's face as the Commonwealth continues to trot out each and every one of these old tropes for mental health. So maybe he doesn't need to, but I do worry that by not taking these little opportunities to remind the jury that the way the Commonwealth is presenting mental health is not the way any licensed and credible professional would look for it, in current year.
Step down. Council, why don't we take a brief recess at this time? So we're going to take the morning recess at this point.
Court, all rise, please.
All right, we're zipping through.
Commonwealth versus Lindsay, Clancy. All parties are present, including the defendant and including the 18 jurors.
All right. Everyone, thank you. Commonwealth, call your next witness, please.
Thank you. Commonwealth calls Amy Bevins.
Do you solemnly swear that the testimony and the evidence you shall give to the court and the jury, no matter how happened in the Commonwealth, will be you may have a seat.
Watch your step, please.
Bless you.
All right, good afternoon. I'd ask you to speak into that microphone, keep your voice up if you could, okay? Okay. All right. Tree spray.
Thank you. Good afternoon. Good afternoon. Can you please state and spell your name for the record?
Amy Bevins, AMYBEVINS.
And your date of birth?
8/22/90.
Do you live in Connecticut?
Yes.
What do you do for work?
I'm a licensed behavior analyst, but I specialize primarily in early intervention for young children with autism.
If you could just keep your voice up a little bit, maybe come a little forward to the mic. How long have you been doing that?
6 years. I was a special education teacher before that for a long time as well.
Do you know?
And okay, again, I tend to get feelings about people, not in the weird, like, I don't like vibes because it just makes me ick. But whatever little, brain to brain connection, she seems like an awesome teacher for those little kiddos. So I am glad that as much as we've seen, indifference in the whole of how the medical system works, there are still really good really good people out there with a heart to serve. And she used to be a special ed teacher, and I have only run into the very best of people when I've run into special ed teachers.
Lindsay Clancy.
Yes.
How do you know her?
We have been friends for almost 29 years.
So you met her when you were children?
Yes.
Did you go to school together?
Elementary school.
And after that?
All the way up through middle school and high school as well.
Okay. And did you keep in touch with Lindsay when you went off to college?
Yes.
I'm assuming you didn't go to the same college, right?
No.
Do you know where Lindsay went?
Quinnipiac University.
And how did you keep in touch?
Through texts, phone calls. We visited each other at each other's campuses.
And then when Lindsay went to nursing school, did you still stay in touch at that point in time?
Yes.
And how did you do that? The same way, like text visits?
Yes. I also lived in Boston at the same time that she was in nursing school up in Boston.
So was your contact more frequent while she was in nursing school versus when she was in college?
I can't remember the exact amount of contact, but I would say we were always in contact together, yes.
Okay. While Ms. Clancy was in nursing school, did she ever tell you that she was taking some mental health medication?
I can't recall.
Did she ever tell you that she was struggling with anxiety or anything like that while in nursing school?
Nothing that I can recall.
And after she was finished with nursing school, did the two of you still remain in touch?
Yes.
And how often would you see her?
I moved back home to Connecticut, so whenever she was able to visit home, we would stay in touch. I traveled to Boston, not very frequently, but I would visit her there as well.
And did you have a text chain going between the two of you?
Yes.
And did you also have a group text with other friends from Connecticut that you both grew up with that you would participate in?
Yes.
And how often would you text with Lindsay?
Pretty frequently. It depended on, I think, the point in life that we were at, but I would say there was regular communication.
And growing up with Lindsay and knowing her into adulthood, how would you describe her general demeanor?
She was pretty a calm person. she was nice and had a very calm approach to herself.
And during that time that you knew her and would interact with her, did you ever notice any changes in her pattern of speech or rate of speech?
No.
Was she pretty consistent in her behavior and speech patterns throughout the years that you knew her?
Yes.
Commonwealth, you're asking her about a time period while she was in school. So, without the stressors of being married and having children, she was able to deal with stress. Well, I think everyone can confidently state that their stressors were different and didn't seem as huge when other people didn't depend on you. So, this is apples to oranges. But sure, make a point if you can find one.
After Ms. Clancy had Cora, were you still in contact with her at that time?
Yes.
And just to kind of get it out of the way, were you in contact with her all the way up through January of 2023?
Yes.
And so after she had Cora, did you notice any changes in her demeanor?
No.
Did you notice any changes in her behavior?
No.
Did you notice any changes in her speech patterns?
No.
After she had Dawson, did she talk to you about that delivery and how that went?
Yes.
And what did she tell you about that?
That was more of a difficult delivery than the one she had with Cora, that she would maybe need to take some time to recover prior to thinking about having a third child.
And during that time, after she had Dawson, did you notice any changes in her behavior?
No.
Or her demeanor?
No.
Her speech pattern?
No.
Was there anything about your interactions with Lindsay during that time that caused you to have concern about her harming herself or someone else?
No.
And then after she gave birth to Callan, did you notice a change in her demeanor at that time?
No.
Or her behavior or rate of speech?
No.
Did you see her in Connecticut in November of 2022?
Yes.
And why did you see her then? What was happening?
She had traveled down to Connecticut. We had gotten together as a group to go out to breakfast.
And had she come to Connecticut alone or with her family?
Alone, I believe, at that time.
And you said you went out to breakfast?
Yes.
Was this with that whole group of friends and spouses and everyone that kept in contact from Connecticut?
Yes, there was a group of us there that had all remained friends.
Did you notice anything about her demeanor or behavior at that breakfast in November of 2022 that caused you concern or was different than her typical behavior?
No.
Did you have some text conversations about in January of 2023 about some issues that Lindsay was having?
Yes.
And do you recall when those messages started?
I don't recall the exact date of the messages, but it was only, I believe, one night.
And in terms of what happened on January 24th, 2023, how close in time was it to that?
Can you repeat the question?
So in terms of January 24th, 2023, when the children were killed, how close in time were your text messages to that incident?
Only a few days.
Okay. And what was that text conversation?
She had shared that she had been taking a medication that caused her to have some dark thoughts, but that she was going to, or had been tapering off that medication and was trialing new ones that would remove those side effects and be more helpful and therapeutic to what she needed.
And did she tell you what those dark thoughts were?
No.
What was the tone of the conversation?
Hopeful, I would categorize it. I remember it being something where there was conveying of hope and that it was.
Okay, no, I just want to get to the defense on this. You can tell she's incredibly uncomfortable to be here. She knows exactly what the Commonwealth is trying to do here. I know what the Commonwealth is trying to do here, and they can't even do it with, finesse. So we are gonna go to the defense.
Or exactly pretty neutral, I would say.
Did she herself?
No.
Mr. Reddington?
Afternoon. You're nervous. Don't be. Okay.
Reddington, you just made my love for you grow 2 sizes. I need one of those I love you thing that we had for Bones for Reddington on, or Dr. Bones, for Reddington. This is my favorite. Like, when he's in, grandpa mode, I am like, "That's it. Every single client of his is innocent. I don't care." He's my favorite. This is the kind of really good thing that you can't teach, but just reaching out and acknowledging that a witness is incredibly nervous. Had the Commonwealth noticed that her chest was starting to break out in hives and that she was incredibly nervous and had just done a little bit of this ice breaking, these are skills that shouldn't need to be taught, but law school should really think about. And look, they're ticky-tacky little things. They're things that are in no way as important as the law. But if you are going to be an attorney that wants to be at a trial, these are skills that are beyond measure important, to know and to use.
You guys go back how far?
Almost 29 years.
And over those 29 years, knowing Lindsay when you guys were in grammar school, I guess, and high school, and then you went off to college and you had your families and your marriages, tell us what your opinion was of her as a person.
I knew her as a good person, a good friend, a good mom.
And you had occasion to see her with her kids and how she acted with her kids, Cora, up till Callan.
Yes.
And did you ever observe anything out of the ordinary, or did she appear to be a loving person and taking care of her kids?
I never saw anything out of the ordinary.
District Attorney asked you about the visit that you had when you were good enough to visit with her at Spalding Rehab. And this was when, in March of 23?
Yes.
And arrangements had to be made for you to visit with her.
Now, there is a part that I skipped over. This woman, went to check on her friend after all of the incidents, the incident that happened. And I don't know that I would be able to reach out to my friend. And that kind of bothers me because, I should be able to work out that my friend would never do this. And this is most likely a mental impairment. But I don't know that I would be able to ever come to that point, in such a short amount of time. So this particular witness did end up going to visit Lindsay, and she was warned beforehand not to talk about the children, not to talk about the incident. Now, the Commonwealth, right before this, basically implied that Lindsay did not want to talk about the kids, that, Lindsay was all about herself, that that she, refused to talk about the kids, that basically that Lindsay was only about her injuries and didn't give a rat's rah-rah about the kids. So that's another reason that we skipped forward. There is nothing that is more guaranteed to throw off a trial stream than the absolute audacity of the Commonwealth or the state or any attorney on either side to so blatantly mislead the jury. There is nothing more indefensible, in my opinion, as an attorney than to willfully, shade the facts so that you are attempting to lie to the jury.
You had to get approval, and whether you know or not, I mean, I had to kind of help you out a little bit trying to get through the red tape to get in there to see her, along with her family approval and that type of thing, right?
I don't recall any of that.
But you were able to get in
Yes.
to visit with her. And this would have been in the beginning of March, if you know, the middle of March, the end?
I don't recall the exact
Okay.
time.
Was she able to walk around and ambulate, or was she in a wheelchair, or what was her condition? Was she in bed?
She was in a wheelchair. She was sitting up the entire visit.
Did you ask her about why she was in the wheelchair and anything like that?
No.
You knew that she had been in the hospital from January 24th, right?
Yes.
And you knew that your friend had been charged by the police and had killed her 3 beautiful children, right?
Yes.
That was a bit of an awkward, uncomfortable topic, wasn't it?
I think it would be for anybody, yes.
Absolutely. And the district attorney asked you whether or not she cried and whether or not she told you about her children and anything to do with her children or that incident. You both basically stayed away from that entire subject, right?
I remember also being told not to bring that up specifically, which at the time I figured that could be due to the recommendation of mental health providers, et cetera, who were treating her.
Right.
So again, I would love to be a fly on the wall in the court to be able to read the jury's faces as they are once again, informed that the Commonwealth has. Look, in my world, if you know the full truth and you obfuscate that as an officer of the law, you have bold-faced lied to me as a juror, and I do not appreciate it. And especially with such an emotionally difficult trial like this, um, if the Commonwealth doesn't think they're going to be punished for this, I do not know what's going on, because I think anyone with even and I realize I have a very low tolerance for BS, but after a week or 2 weeks of this, I don't think the jury is at all tolerating this or dealing with this. And Samantha Shoe Lover, serious question. Do we as a society place a higher standard on women when it comes to seeking help and or protecting the kids? And I'm asking because why did the husband, dad not see any of this? I don't know. And I don't want to. I didn't live in the house. I didn't know their marriage. And the last thing, Rogue, I love you. Yes, yes, and all the yes. I am making this into a pen. Whenever you feel like you can't get up and handle the day, remember this man has probably felt that for the last 40 years of his life, and he keeps going for justice and to make fun of the Commonwealth. And look, as a person who's motivated 93% out of spite, I am okay with that.
Who told you that?
Her sister.
Now, how long did you visit with her?
It was brief, maybe 30 to 45 minutes.
That's all I have. Wait a minute. Did you guys have a group get together in December of 2022, if you recall?
I don't recall.
Do you recall seeing her after Thanksgiving around that time frame in December of 22?
Samantha Shoe Lover, I'm not sure. I'm not sure if he was overworked, if he saw his place more as the provider and providing for the extra income that, Lindsay not going back to work kind of cost them. I don't know if he felt like, oh, she's being, she's under professionals' care, so this must be getting better. I don't know, and that's why, it is so hard to make sense of this case to the point you can make sense of it, because I don't know what, Lindsay I in her full-blown depressed state looked like, um, if he had figured out a way to interact with her, or if he was, as much as we talk about masking and burnout, I think this is a really good point to bring up that, a lot of caretakers are running on empty, and sometimes we forget because they do such a good job at taking care of us and taking care of everyone, that they might be running on below empty, and all the work that goes into be a caretaker and worry. And it's not that you don't care, you know, or anything, but it can be just as much of a drain as being the person, dealing with a mental health or health crisis. So while I think it's easy for all of us to kind of knee jerk reaction say, he was there, why didn't he notice? I think if you take a step back and you give Patrick the grace that, having been on the other side and having the opportunity, the blessing, and the real heartbreaking opportunity to help my mother-in-law, a woman who had known me for 15 years. She'd been there for the birth of my last child, like, she was in the room, and she looked at me and she said, "Are you new here?" And I can't imagine being a caretaker day after day and having to deal with that or any other level of things. So I do try to have a little bit of grace for Patrick. I know there are a lot of internet, conspiracies that are going through and trying to figure it out, but caretaker burnout is real. Sometimes the simplest answer is right in front of our face, but we want the salacious one.
I don't recall no.
Do you recall having conversations with her around that time frame, which would be in December of 2022, that she was talking to you about medications and asking you questions about a particular medication?
I don't recall the exact time frame of those conversations.
Okay. You were summoned here today by the DA's office, is that correct?
Yes.
You were also on my witness list as well, right?
Yes.
And when I ask you about the conversations, the reason is you were questioned by the state police back in January of 23. Do you remember that?
Yes.
And one of the troopers had asked you whether or not you had any conversations with Lindsay, your friend, about medications. And you indicated that, and I quote, page 12, she knows that I'm pretty open about mental health, that I'm a big advocate of mental health. And she asked me if I knew, if I had tried a medication. Do you remember saying that?
Yes.
Okay. Does that refresh your memory at all as to approximately what time, when that was? Would that have been in December of 22, after Thanksgiving?
I don't know. I still don't recall the exact time, but I do remember that being a conversation that we had.
Okay. Do you remember where you had the conversation?
It was over text message.
Okay. Do you recall her asking you what your experience was? Because you had some knowledge of medications, correct?
As a patient.
Okay. And as a result of that and being close and good friends, that she had asked you what your experience was. And again, it's page 13. And she would say, how was your experience? Did you ever take this? What was your experience with this? That type of thing. Do you remember that? That conversation?
I don't recall the specific conversation.
Do you recall the medication that she asked you about?
Yes.
What was that?
I remember it being Lexapro.
Do you recall in your text message exchange that she had asked you about or told you about some of the medications that she was taking and that there were some difficulties with it?
Yes.
Do you remember that she had asked you whether or not you had noted or if you were aware of any side effects of medications?
I don't recall.
And after those text threads and with that understanding, being as close to Lindsay as you were, she then confided in you that she was having dark thoughts, as I think was the expression.
That was a long time after the conversation that we had about the medication. I do remember that being the first time I had heard any concern around her mental health up until that point.
Okay, and what point was that, if you remember?
Can you restate the question?
Sure. Let me ask it this way. When she told you that she was having problems or difficulties with the medication and when she was telling you that she was having dark thoughts, do you remember when that was?
Towards the end of January 2023.
Okay. Do you remember, was that in person or was that a message, text message?
Over text message.
Did she explicate or did she explain what the dark thoughts were?
No.
And the next time you saw her after that was at the hospital rehab, correct?
Yes.
Thank you, ma'am. That's all I have.
Counsel? All right, thank you, ma'am. You may step down.
Now, I believe we get
Come on,
to,
Christopher Clancy.
this is going to be Lindsay Clancy's father-in-law. Sorry, I'm being assaulted by a cat who doesn't realize that I'm trying to fast forward and can't pet him.
Good afternoon, Commonwealth. Have a seat.
Thank you. This is my water.
You are ridiculous. Come on.
Okay.
Good afternoon, sir.
Good afternoon.
Hi, call.
Thank you. Good afternoon. Can you please state and spell your name for the record?
Say that again. I'm sorry.
Could you please state and spell your name for the record?
Yes, Christopher William Clancy. CHRISTOPHER WCLANCY.
And what's your date of birth?
7/26/61.
Where do you live?
Situate, Mass.
And do you work?
No, I'm retired.
What did you do before you retired?
I was a plumbing contractor.
Is Patrick Clancy your son?
Yes.
When did you first meet Lindsay Clancy?
I don't know what the year was, but I believe I met her for the first time at my at the cottage in Hull. That was my parents' house, and I believe that's when I met her. I think he brought it down there.
Was that before or after she and Patrick had gotten engaged?
That was before.
And eventually they got engaged and got married, correct?
Correct.
And had 3 children, correct?
Correct.
So I want to direct your attention to the time frame after Callan was born in May of 2022. Did you have a chance to observe Lindsay interact with Callan?
Yes.
And what was Lindsay like with Callan?
She was very mothering.
And was she
Not the mic.
protective?
I would say yes, like any mother would be.
Do you recall describing her previously as very protective of him?
I would say that she was very protective of him.
Was she, in terms of how protective she was of Callan versus Dawson and Cora, was she more, less, or the same?
I would say she was more of the same when the babies were little, when the babies were young.
So was that something typical when she would have one of the children? She'd be very protective when they were first born?
Yes, I think.
Why is the Commonwealth talking like she's never seen a real mother in action? Like, so when humans, which are primates, have children, they're warm-blooded creatures. They tend not to, drop their hatchlings and eggs. They tend to form solid attachment, relationships and bonding things with their children. Is the Commonwealth part Borg? I feel like they're just newly hatched on this planet and they're trying to understand how human bonding works. And usually I don't feel that kind of kinship with people. It's very dehumanizing, but it's also it clearly shows their blind spot that they are they are so clueless how motherhood works because yes, you are snappy, you are very protective of a newborn. Um, so much so that, my and bless his heart, he would have been okay, I think. But, middle feral boy did not get to be around his younger brother, youngest, most feral, because they were only 18 months apart. So, yeah, you don't leave the toddler in charge of the baby. There's a, term I label toddler gentle, which is the terror every mother has of bringing their newborn home to a toddler because it's like, "Oh, remember when your brother had 2 eyes? Yeah, that's before your brother tried to hug your eye." Um, so yes, you are constantly on high alert because toddlers love their little brothers and sisters and or dislike them. And they're toddler gentle, so they don't know that winging, a full sippy cup at the baby's head is terrifying, but I have I have turned into Neo, and I have, dodged that sippy cup. So, Commonwealth, it's gonna be insane when you have kids.
That's like any other mother, though.
And how often would you see the family?
We saw them regularly. They lived not too far from us. They lived in Weymouth first, and we saw them regularly.
And then eventually they moved to Duxbury?
Yes.
And directing your attention to the time frame between November 16th, 2022 and Thanksgiving of that year, did you see them at your house?
I think they did come up to our house one time. Might have been a Saturday or a Sunday.
Okay. And why did they come over that day?
I think they just came over to say hi.
And what was Lindsay's demeanor that day?
Very good.
And was there any difference in her behavior or speech pattern than what you've seen with her previously?
Not that day.
And how was that visit?
Very good.
Did you then see them at or around Thanksgiving?
Yes, we did.
Okay. And where was that?
That was at my daughter Laura's house in Hamilton.
I'm sorry, I didn't.
In Hamilton.
And did you interact with Lindsay that day?
Yes.
What was her demeanor that day?
She seemed a little, how do you say it? Let me think for a minute. She seemed quiet.
Okay. And did she seem to interact with everyone there as she normally?
Now, I do hope that the defense, because she's been described previously as being more on the very competent, but not what one would describe as bubbly. But I think, or I hope the defense asked the very simple question: Was that normal for her? Was that her baseline? I mean, you noticed it, so obviously it wasn't her baseline, but to get that out in the open, I think is one of those small things that, and again, I'm not in the jury room, so the jury might be thoroughly, done with the Commonwealth. And Heidel, devil's advocate though, some moms experience detachment and don't bond, so as they should with their babies because of previous detachment issues through childhood and hormones, and you are very correct. You know, as much as I can speak about my kind of way of masking, there is a detachment sort of masking, where you deeply love your child, but, because of, past traumas or other things and the cascade of hormones, you find it very difficult to bond with your child. So, um, it's just like I've been saying this entire time, everyone is going to present differently. And, it is an incredibly hard thing to diagnose someone with the different ways and ranges that people can present individually. So I don't discard or discount that very, difficult job. But this doesn't seem like a case where, you hear hoof prints and you think zebras. it sounds like a very, kind of by the book. These are very dangerous escalations, and, someone should have been paying attention.
Hollywood?
Yeah, she was very close with my daughters and her sister-in-law.
Do you recall them wearing coordinating shirts that day?
I think so.
And during dinner that day, did you make observations of Lindsay getting the kids settled down for dinner?
I did.
And did you see her interact with Dawson?
Yes, I did.
And can you describe that interaction, please?
Mm-hmm. She was getting a little frustrated. Dawson was being a little silly, and she was trying to get him to sit down. And she was just a little bit getting frustrated with him, and I noticed it. So I got up to help her.
And when you saw her getting frustrated with him, did you see her do something to get him seated?
She took him by the arm to get him seated. It wasn't anything crazy.
Right. It's not like she hit him or anything like that.
No.
Right? She just took his arm and guided him to the seat. Is that correct?
Correct.
But you could see that she was frustrated.
I could.
And so you stepped in to help her, right?
Correct.
And what did you do to help?
I got her a plate, I believe. There were a lot of people, so it was just a little chaotic.
Now, directing your attention to the weekend before Christmas 2022, did you stop by their home that weekend?
I believe we did, yeah.
And who was there?
Her parents.
So it'd be Lindsay's parents, Lindsay, Patrick, and the kids?
Yes.
And were you by yourself or with your wife?
I was with my wife.
And was there a specific point for everyone stopping by and gathering that day?
I don't recall that.
Okay. Were you and your wife checking in or helping out that day?
We might have just been going down to check on things.
Okay. Did you know that there were some struggles going on at that point?
I did.
And did you know that Lindsay was, specifically Lindsay was having some struggles at that point?
Yes.
Did you stop by again a few nights before Christmas?
I thought that's the night you were talking about. Yes, I guess we did.
Okay. And when you stopped by the night before Christmas, do you recall who was there that day?
I think the same people, but I'm not positive.
So Lindsay's parents, Lindsay, Patrick, and the kids?
Yes.
And what was Lindsay's demeanor that day?
It was okay. It wasn't terrible.
Do you recall testifying previously and saying that she seemed like she was in good spirits?
Yes.
Would that be accurate?
Yes.
And when you were there at the house that day, did you make plans for the following day for Christmas Day?
Yes, we made plans to go to Mass.
And who was going to go to Mass?
Lindsay, Patrick, the kids, my wife Sue, and me.
And did you all, the following day on Christmas, did you go over to Lindsay's home before going to Mass?
Yes.
Okay. Did you all gather for breakfast?
I don't recall.
And let me approach.
There's also something so incredibly gross about bringing up these photos of, better times with these witnesses. It's just ick.
All right. Okay.
Is that refreshing?
I know it's not intentional, but his swirly pattern of the little hairs that could are really fun to me. I know it's probably because I am looking at myself and seeing Cindy Lou Who, but it does remind me of something you would see in Dr. Seuss as a side tangent.
Yes.
So did you go over that day for breakfast?
Yes.
And how was Lindsay's demeanor that day?
It was good. She looked beautiful. She had a beautiful dress on.
And do you recall saying previously she seemed very happy that day?
Yes, she did.
And after breakfast, did everyone go to church as planned?
Yes.
And how are the children in church?
Fantastic.
Very well behaved.
Very well.
And then after church, did you have a conversation with Lindsay outside of the church?
I think we talked a little bit. I don't remember what we said, but we were going our separate ways.
Do you recall saying previously that Lindsay said she was glad she came and she really loved it?
Yes.
What was her demeanor while she was engaging with you after Mass?
Okay, again, speaking as a person who usually I want to love social functions. People are fascinating, and my people, my tribe are awesome. So, I love going to Dollywood. Perfect example. If you meet me, I am having a blast. Like I am legitimately not hiding or masking beyond like the little weird sensory things that are bothering me. I'm having a legitimately good time, but I am also exhausted at the end of Dollywood and need about a week to recover. So it's not that we can't do these things, it's just that they require a lot more energy. So it is these sort of weird litmus tests that the Commonwealth is using that you're like, none of reality works the way you think it does.
She was quiet. She said that she liked the Mass and she was really happy that she went.
And do you recall saying before that strike that. Do you recall after that conversation, you guys hugged each other and went your separate ways?
Yes.
Did you see the family again after Christmas?
I'm not sure. I'm not sure.
Okay. Did you go to Cora's birthday party?
No.
Was it more of a kids gathering at a trampoline place?
That's what I heard.
Okay.
Yeah.
All right. Did you have plans to see them Tuesday, January 24th, 2023?
No.
Do you recall saying previously that there were plans to get together for dinner that night, but they changed because your wife had plans with her brother?
No, we never had plans to go there Tuesday night. They asked us to come to the Tuesday night, but we already had plans with Sue's sister Joan.
Okay, so there weren't set plans, but you were asked to come to their house that night.
Yeah.
Okay. And then you couldn't go because you had other plans.
Right, we were going to make it for Friday.
Thank you for clarifying that. In terms of your interaction with Lindsay and Patrick and the kids, while there were some struggles going on, did you and your wife offer to take the kids to your house overnight to kind of give them a break?
I did mention that to my son.
And was that offer declined?
Yes.
And going back to
Oh, wait, no.
Thanksgiving of 2022, when you were interacting with Lindsay, I think you
I can't deal with the lip smacking right now. So we are getting into some more Reddington action because I didn't realize we'd missed this yesterday. But apparently, as Lindsay was sobbing, emotionally sobbing, apparently one of the mics. Now I am glad I didn't hear this because I had a meltdown yesterday over StreamYard not working. And I know part of it was because I was so mad at at the way the medical examiner testimony was treated. But apparently one of the unfeeling Hagathas decided to whisper shout into a hot mic to have someone shut Lindsay up. And apparently Reddington was not happy, and I am here for it. Reddington, let's go. 'Cause, the F you say?
I really don't want to go to the sidebar.
I need to know what you're going to talk about before.
I want to tell you that
you know-
they got picked up on a hot mic saying, shut her up during the playing of that autopsy.
All right.
Oh, Sanderson's sister, shut the hell up. You totally did.
This is not like Handmaid's Tale. So you're gonna tape them out.
So I'm not doing that at all. I just want to find out what the issue is. There's a lot of privileged issues, and then you can tell me that, and then if
Oh, there's Reddington bringing the receipts because they're like, we didn't do that. You didn't catch us. Yeah, we did in 40K, actually, the Heifer Squad. But I was perusing the X, to see how things were going today since we are behind, and I came across that little gem, and thank God, because thank God Bredington was able to handle it and I didn't hear about it because, I have never been more disgusted in my entire life, and, the display they put on was absolutely, just grotesque yesterday.
You previously said that her demeanor was good. She was quiet. Did you also say at one point she had a little blankness to her at times?
She seemed to at times.
And can you tell us like what that was?
Just like a stare.
Kind of staring off into the distance, distracted?
No, just not totally interacting, just sort of.
Okay. So at some points.
Almost like nervous, kind of like.
Nerves.
Almost just like, something like that.
Okay, so at some points she was staring a little bit, seemed a little nervous, but then in other times she was interacting with everyone as she normally would?
Pretty much.
Okay. You mentioned earlier when you were talking about Lindsay having a little bit of difficulty getting Dawson seated at Thanksgiving that he was being a little silly.
Yeah.
Was that typical for him to behave in that way?
Yeah, he was a handful, but he was good. He was a good boy.
Going back to the night of January 24th, 2023, at some point in time that night, did you get a phone call from Patrick?
In January?
January 24th, 2023.
Yes.
What a gross, disgusting. Again, there's not even that conciliatory kind of lowering of the tone. Most people do this instinctively when you are coming to a sensitive or subject that you are aware might cause emotional pain to another person. We tend to address it even subconsciously. We tend to go into a lower kind of more calming register, and we tend to say, about the night in January, like we tend to telegraph that we're going to be going into a uncomfortable situation subconsciously, to the point that the other person in the conversation is going to be like, oh, you want to bring up that. So this is just another, it seems cruel. It seems cruel to kind of blasé bring this up without that even a modicum of, again, you can hate Lindsay's guts. I don't agree with your, perception, but you don't have to extend that lack of care to the rest of the witnesses, and I think that they are unable to do it.
Go ahead.
Yes, we did.
And what was his demeanor during that call?
What was his demeanor?
Yes.
What was his demeanor during the call that he... Okay, no. You guys, no, we are not going to watch this father tell us about his son losing half of his family. No. Sorry, you guys, this is just, no. All of the no to that. I'm not slowing down, but
Heard from many lay witnesses.
holy shit, do I have a wig? And I would have to buy a floral blouse. But that is a look that is going in my repertoire Rolodex post haste. Sorry. Thank you for allowing me this detour on my ADHD. I- Did who is this person? Did we not have a cross on the father-in-law, which I would find appropriate? JKD Buck, I will use it responsibly only when I want to go to the VFW and make a kick-ass haul on bingo. And I wouldn't touch Kim Fields. No, that was not the person I am going to be imitating.
Court, all rise.
Hey, Commonwealth, learn to Commonwealth, if you need to whisper, and obviously you two hooven, heifers cannot be, gentle or utilize any bit of finesse, turn your microphone off, you dumbass.
This court's now in session. Please be seated.
Good afternoon, Your Honor. For the purpose of the record, we return back to the trial of Commonwealth versus Lindsay, Clancy. All parties are present, including the defendant and including 18 jurors.
And Clerk, thank you. Members of the jury, good afternoon. We're going to return to the case. Attorney Sprague.
Thank you, Your Honor. Commonwealth calls Kyle Carney.
Good afternoon, sir. Stop right here with the right hand to the clerk, please.
Good afternoon. Do you solemnly swear that the testimony in the evidence you shall give to the court and the jury in a matter not coming between the Commonwealth and the Thank you, sir. You may have a seat.
Please. Excuse me, can we proceed?
Sure. Yep. Good afternoon, sir.
Kyle Carney.
Thank you. Good afternoon. Can you please state and spell your name for the record?
Yeah, Kyle Carney, Kyle Carney.
And your date of birth, please.
July 6, 1991.
And what town do you live in?
Duxbury.
What do you do for work?
Work in finance.
And are you married?
Yes.
Who's your wife?
Sarah Carney.
And you have children?
Yes.
Does your family, or did your family know the Clancy?
Commonwealth. This is not, I know this is going to be weird for you as a Borg, newly spawned on this planet. But yes, normal people do have, like, you have a wife. Yes, I was issued one by the Borg. Children also issued? Yes, by the Borg. Why does she seem so confused? Both of them seem so confused by the concept of family. It's kind of startling.
Family.
Yes.
And did you know them through your friendship with Patrick Clancy?
Yes.
When did you meet Patrick Clancy?
2009.
And how did you meet?
We went to college together.
And after going through college together, did you remain friends after school?
Yes.
And eventually, did you end up living in Duxbury at the same time Patrick and his family lived in Duxbury?
Yes.
When did you meet Lindsay Clancy?
Maybe 12 years ago.
Did you meet them before they were married? Did you meet Lindsay before she married Patrick?
Yes.
Okay. And then obviously you knew them after they got married and as they had their children.
Yes.
How often would you see Patrick and his family while you were both living in Duxbury?
maybe every other month.
And would you interact with Lindsay Clancy during those gatherings?
Yes.
And what was her typical demeanor?
Kind, caring.
Did you ever see any changes, significant changes in her behavior or demeanor when you would interact with her?
No.
Did you notice any changes in Lindsay Clancy after the birth of Cora or Dawson?
No.
Directing your attention to after Callan Clancy was born, did you interact with the Clancy family that summer?
Yes.
And how so?
Maybe beach dinners. It's hard to recall exactly.
So you said beach dinners, is that what you said?
Yes.
So basically families gathering together at the beach, having dinner, interacting with each other, is that right?
Sure.
How often would you do that during the summer of 2022?
I couldn't tell you exactly.
More than once?
Yeah, like at least monthly.
Okay. Did you also go fishing with Patrick during that time?
Yes.
Over the summer of 2022, did you notice any differences in in Lindsay Clancy's demeanor or behavior?
No.
Throughout the fall of 2022 into the beginning of
Yeah, but Commonwealth, that's not the score you think it is. So once a month for the entire summer was a total of, at the high end, let's say 4 to 5 times. Let's say there was 1 month where they were like super crazy and met twice. So 5 times she seemed normal. Again, not the flex you think it is.
January 2023, would you see Patrick Clancy?
Yes.
How often did you see him?
Again, maybe once a month, maybe.
And directing your attention to Sunday, January 22nd, 2023, did you have a small gathering at your home?
Yes, their family came over to my house.
Okay. And when you say their family, are you talking about Patrick Clancy and Lindsay Clancy?
And Cora and Dawson, too.
Callan didn't join them?
No.
Was he home with Lindsay's parents?
Yes.
And what was the purpose of gathering that day?
Just to socialize. It was a nice day out. I was having a fire to burn some brush in my backyard, and thought it'd be nice to invite them to come over and get the kids out and enjoy a nice day.
And what was Lindsay's demeanor that day?
I'd say quieter than normal.
And do you recall saying previously that the weekend was fairly normal, that Lindsay had always been a little tough to get a beat on, kind of quiet, but you were in the kitchen talking and it seemed normal?
I mean, in the kitchen, we had a conversation, and that was normal.
Normal, okay. Do you recall describing the day previously as a
He right now is working very hard not to show anything. I think that he is also a super people watcher, if I have to put my finger on it, but he also realizes that he is being watched. So I think he is possibly a super masker, highly professional, highly regimented. Um, I can't get a read on how he feels about being called, but given this level of rigidity in his posture and kind of lack of elaborating, I do not think that he appreciates the questions. He is probably now in his head thinking of 99 ways he would have interrogated himself better. But he is also here, and he realizes this is a game. This is someone who is very aware that this is a game, and the more the Commonwealth talks, that's why that little smile is growing there. He realizes he is playing with unarmed opponents, and that this is the point at which I myself would take the dark side, and I would start answering dumbass questions with dumbass answers. but he is probably not going to display that because of the compartmentalization and the regimentality that I'm guessing. Now, it's not fully regimented. His top buttons unbuttoned, so he isn't so regimented and meticulous that he will spite himself to maintain, rigid adherence to tradition, but he is aware of what is going on here, and this is the face of, again, a competent watcher, people watcher, and humaner who is realizing that he is playing with an unarmed opponent.
Perfectly normal afternoon, really nice.
It was a nice day. Yeah.
Okay. And so there was nothing out of the normal that happened that day in terms of Lindsay's behavior or demeanor?
Her behavior, demeanor appeared normal.
Okay. Did you have any problems communicating with her when you had conversation in the kitchen?
No.
Okay. How long was the family there at your house that day?
Maybe a few hours.
And during that time,
Because this is the type of answer I give you when I am legally or socially required to give you some kind of response. I am not going to help you out. I am going to give you the barest of what you ask of me. And he's clocked everything. I and look, I could be completely wrong. I am not saying that any of this is right, but that's what I'm getting from him. It's turned out to be more right often than not. In fact, the only thing that trips me up in my basic people watching is that I extend grace that I know is probably going to be misused to people that I know are probably going to not use it correctly. But I'm always hopeful that, it will go better. Now, it usually doesn't, and that's why you end up with a more and more cynicism as you become a people watcher, an older people watcher. But that's what I'm getting from him.
I believe you described it previously as a normal, great day. Would that be accurate?
Yes.
Okay, thank you.
Mr. Reddington?
I have no questions. Thank you, sir.
All right. Thank you, sir. Okay, step down. Thank you.
Thanks. Watch your stuff, please.
Yacchio is this next witness.
All right.
Good afternoon. Right there, raise your right hand for the clerk, please.
Good afternoon. We solemnly swear that the testimony and the evidence you shall give to the court and the jury will not find between the Commonwealth and the defendant shall be true. Thank you, sir. You may have a seat.
All right, good afternoon, sir.
Thank you. Good afternoon, sir. Can you tell the jurors your first and last name?
Andrew Chiacchio,
Can you please spell your last name for the record?
Chiacchio.
And what do you do for work?
I work for the state police
And how long have you been with the state police?
since December of 2013.
And what's your current assignment?
I work for the Plymouth County State Police Detective Unit.
How long have you been with the state police detective unit?
5 years,
And what's your current rank?
sergeant.
I'm going to draw your attention back to January 24th of the year 2023. Were you still working for the state police detective unit with the district attorney's office then?
Yes,
And do you recall being called into an investigation in regards to an incident that happened in the town of Duxbury on January 24th, 2023?
yes.
Were you assigned as the case officer for that investigation?
Okay, are we getting to anything? Surveillance video, timeline, fire responders, crime investigators, who's the sergeant? Okay, now we are getting into a Facebook.
May 5th, 2021.
It is.
I would move to admit this as the next exhibit.
No objection. That may be admitted.
17.
Oh, what damning evidence will we get from the Book of Face?
Sergeant Kaki.
Wait a minute, wait a minute, wait a minute. As a person who has labeled her youngest child, her youngest, most feral child, who this is this is mild. Lovely, hello, lovely parents. I'm looking for some advice, solidarity, or ideas, something, anything. I am truly finding my 19-month-old to be the most difficult human I've ever encountered. Um, all toddlers are. All of them are. I mean that with all the love in my heart, but I honestly can't make it through a day without getting so frustrated with him. He's not my first child, so not to compare because I know that every child is different. Uh, but this isn't my first rodeo. Every single thing with him is a battle. Um, and this doesn't seem like a woman who's like, "I hate my children. I would like to be rid of them, please. Book of Face, please tell me how to do a spell or magical incantation to, n this is their damning evidence."
They're just showing you what's now been marked as Exhibit 217 on the screen. Is that a Facebook post from the Attachment Parenting for Littles Facebook group?
Every single thing with him is a battle, and it's been this way for a while since he was maybe 8 months old. I really try to pick my battles and only do what's completely necessary, but I mean everything, getting out of his crib in the morning, going downstairs, changing his diaper, getting dressed, getting him into his seat to eat, getting him into the car seat. Yeah, these are I this was what are you showing me, Commonwealth?
Yes.
And through the information you received from the search warrant return, you were able to locate the content of this post in the records for the Attachment Parenting for Littles and confirm that it also appeared to be authored by Lindsay Marie Clancy, correct?
Correct.
Or by the Facebook page of Lindsay Marie Clancy.
Yes.
And fair to say it reads, "Hello, lovely parents. I'm looking for some advice, solidarity, ideas, something, anything. I'm truly finding my 19-month-old to be the most difficult human I've ever encountered. I mean that with all love in my heart, but I honestly cannot make it through a day without getting so frustrated with him. He's not my first child, so not to compare, because I know that every child is different, but just for background, this isn't my first rodeo. Every single thing with him is a battle, and it has been this way for a while, since he was maybe 8 months old. I really try to pick my battles and only do what's completely necessary, but I mean everything, getting out of his crib in the morning and going downstairs, changing his diaper, getting him dressed, getting him in his seat to eat, getting him in the car seat, getting him out of the car seat, putting
Commonwealth. I don't know what Western wear uh, I don't know what American Girl doll you took from your collection and stole their bow, but kindly give Carolyn the colonial her bow back, okay?
on his jacket and shoes to go outside, having him come inside when it's time, going to sleep for his nap, and at night, he fights me every step of the way with all these normal daily activities. It constantly feels like I have to force him to do these things, which feels so wrong, but he is always fighting me and crying about doing these very normal things. You recall seeing that message in the records.
I do.
And fair to say there was some comments to the records and also an acknowledgement by the person with the Facebook page, Lindsay Marie Clancy, thanking the contributors for their advice.
Yes.
I have no further questions.
Can someone explain to me how the Commonwealth thought that was a good idea? Because legitimately, they are over here like full Miley Cyrus wrecking ball, feeling, hotter than any one of the, you know, oh God, one of the brothers that she dated and then Hemsworth. Uh, y- uh, they're like We have recipients, and this is the receipt you decided to go with? You know, far be it for me to question my enemy when they're, well, I don't know if sucking, well, all the donkey is an appropriate term, but that is the one that is most accurate here. But what was it you were planning to achieve with this? Because I am all confused, and you should at least know what you plan to achieve with this. Hell, even, the guy from Night Court is confused as to why he is here in court.
Mr. Reddington.
Good afternoon, sir.
This would be
His face walking up there. I'm gonna need a subtle petty replay. Cause just the walk as he's going over there, like they can't be this stupid. Is there something written in invisible ink that I'm not getting here?
Good afternoon, sir.
So this would be Exhibit 217, which is the Parenting for Littles post by Lindsay, correct?
Correct.
And this was back in May of 2021?
Yes.
And she was talking about her son, who at the time was 19 months old?
That's correct.
Now, as a state police officer, you know how to investigate things, right?
Yes.
You guys must have turned things.
Damn it, Reddington. You almost made me pull a Mo. I now feel how everyone who is around me feels. Do not take a drink when Attorney Reddington is on cross. We may all die.
Inside out to find out if Lindsay Clancy was ever abusive to her son Dawson, right?
That's correct.
Found nothing, did you?
No.
Thank you. That's all I have.
Anything on that?
No, thank you.
Thank you, sir. You may step down.
Thank you, Your Honor.
I'll just step, please, sir.
And it's going to take, there's a motion or a hearing I have to do with lawyers. And it's going to take a little bit of a while. So I'm going to excuse you for today. Come back tomorrow, 9 o'clock. One of the questions I asked over here was where are we on the time estimate? All right. I'm told that we are on schedule, if not ahead of schedule, in regards to what we told you. All right. So I'm going to excuse you till tomorrow. We're going to stay here, do a few more things. And I'm just going to remind you, as I've said every night, you have to have an open mind. Don't talk about this with anyone. Don't do any research about anything. If you see anything about this case or any similar cases, don't read, listen, or watch anything in regards to that. Don't do any research on this or any matters that you have or questions you have in your mind. Don't take any field trips. Don't happen to just be driving by certain areas that you think you want to double check. We've done that. All right. So work so hard.
All right, we are going to get into the motion hearing because I do think that this is the point, and I did see updates about this, where the defense is finally going with what is the Commonwealth attempting to prove here? Because we are confused. Are we saying that she didn't attempt to take her own life? What are we trying to prove here? Because the Commonwealth has gone out of their way to kind of indicate that Lindsay's injuries, or at least the only ones that they talk about, were completely superficial, according to them.
President, the court will dismiss the session. Please be seated.
All right. So we're going to be in recess until 3 o'clock. We're going to come back. We'll have a hearing on. They'll hear from the Commonwealth a couple of weeks ago. Same, at least mentioned the same witnesses. So, so I'm going to hear first from the defendant. They'll hear from the Commonwealth. I will probably take it under advisement and review some of the other documents, but I want to make this decision as soon as I can, so everybody kind of can plan on how they go based on the decision. So, so Mr. Reddington, let me hear you first on this.
Thank you. Your Honor, obviously.
We only, honestly, if I were a juror, I would have checked out day 1 week 2. I believe it was all of the first responders that had attended the scene, and that was an incredibly difficult start, and it didn't get any better. So by yesterday, if not all of the jury is emotionally burnt out, I would think yesterday with the ME would have burnt them out, because even if you don't like Lindsay, even if you are part of the jury, that the facts are lining up, that something, for whatever reason, you feel like this was more manipulative than mental health at this point, it still has to be uncomfortable to watch a woman that you were told by the Commonwealth hated her children, like wanted to be rid of them, weeping hysterically about the ME thing, or the ME's testimony. So I don't know. I would imagine that nearly every single one of the jury members has emotionally checked out. I would have probably been one of the last ones to emotionally check out. Again, with that really internal kind of fatal flaw of extending mercy to people that have proven over and over again they don't deserve it. I would try to go in each day if I were a juror in this trial and give the Commonwealth a new chance, because I want to, be respectful to the idea of both sides of this case. But I am not listening to what they're telling me. They have been caught in too many lies. So if you disregard the emotional, burnout that they have already done to the jury, the fact that they have already been caught in so many different kind of narrative shadowings into, instead of just giving the facts, and they've been easily corrected on cross, it's not a good look. So I don't know what the jury's thinking, but I would be pissed off, and I would be less than open to anything the Commonwealth is telling me now, because I am looking for the lie, I am looking for the omission, I am looking for the part that they didn't tell me, and the part that's going to be corrected by Attorney Reddington.
Not to belabor the obvious, this is a murder trial, very serious business, and we've all been working very hard on the discovery, which, as you can tell, is voluminous. Hundreds and hundreds and hundreds of pages of state police interviews. And I mentioned, about with the government. They have cops. They have people going out and interviewing. They have videos. They have chemists. They have detectives. They have local cops. They want a cup of coffee, they can send 5 cops down the street to get one. I'm it, except for my son, Patrick, who helps me out getting coffee, all right? And the reason I sound frustrated is that they are objecting 2 weeks ago because they need time to review, to cross-examine doctors on very basic items of evidence that are their items of evidence. Not one of those witnesses is adding or bringing anything new to the discovery, if you will. And not by way of excuse, but, I am a sole practitioner. In the past, May, June, July, in the past 3 months, I've had a murder, a rape, and 2 back-to-back federal trials that ended 1 week before we impaneled on this case. I have worked really hard to pull this case together with expert witnesses, civilian witnesses, private investigators been investigating. I provide everything to them as soon as I get it. And they have been doing the same with me. I haven't objected to one thing that they have offered. They put an AutoCAD computer animated display disc on my desk last week. I didn't complain about it, run to you and try to exclude it. I said, fine, no problem, put it in my pile and move on. That's it. So to suggest that they need time to be able to cross-examine both, I've had trials with both of these prosecutors. They're both experienced. They're very, very familiar with the trial of major criminal cases. I feel that they're more than capable.
Reddington, I hate to say this to you, but objection, facts not in evidence. They are not smart, they are not knowledgeable, and they've done other cases. Have they ever won one? How do they stay employed?
Of being able to cross-examine, for example, number one, Dr. Volkovich, who is a board-certified emergency medicine physician. His report indicates that he has taken a look at South Shore Hospital. He's taken a look at the Brigham and Women's Hospital. He's taken a look at the photographs. That's their evidence. That's all he looked at. And all he's doing is basically what all of their South Shore doctors came in and testified to as to the nature of the injuries, in his opinion, the type of injury that she suffered, talking about the injuries to the right and left wrist as well as the neck. In his opinion, dealing with suicide attempts, that it's a legitimate suicide attempt. There's no secrets. There's nothing new that they have to prepare to cross-examine him on. Dr. Lapasada is a doctor that is well known to most of us, and I've been using Dr. Lapasada's fine services for the past decade or longer. I know that both of these attorneys are familiar with her. She's not bringing anything new to the table. She's bringing her opinion based upon their evidence as to the medical records, x-rays, all of the rest of the indicia of the injury that she suffered. Now, they're talking about Lindsay going out, hanging off of a window, and then doing, like I said, the Spider-Man slide down the side of the house, apparently. Absolutely ridiculous. She dove out that window, she hit her head, and she suffered what Dr. Lapasada refers to as a Jefferson fracture of the spine that is very, very, very typical for this type of an injury. When somebody dives into the shallow end of a pool, they get that injury, unfortunately. When somebody, kids are on a boat and they're drunk and one of them jumps off a mast into the shallow end of the water off of Cape Cod, they get that type of injury. Superman, when he gets thrown off the horse, 6 feet high, same injury. That's all. She's not bringing any esoteric theory to this case that they need time to prepare. Interestingly enough, the Brigham and Women's Hospital records do make reference to the Jefferson fracture right from jump. She also assists me, as she always does, on autopsy photographs, any indicia of injuries, and it's her opinion that if they try to say that there are bruises to these little babies that were inflicted by her, they're absolutely wrong. And Dr. Lapasada would indicate that these are consistent with either EMT, God bless those first responders, but they were in a panic and they're trying to take care of these kids and pick them up and run them up to their trucks and vehicles. So, and other, obviously the interosseous injection into the legs, the shins, the thighs, all of these bruises are from medical intervention, not Lindsay Clancy. That's what she would testify to. That's it. They don't need time to prepare to cross-examine for that. Finally, I have Dr. Condi. Dr. Condi signed even better than a report. He signed an affidavit. And again, it's based upon medical records that we all have. Way back when this case first started, the government presented the case to the grand jury. First thing I said to Lindsay was sign a release. Let the government get all the medical records. We'll all have access to them. This case is obviously going to be predicated upon the medical records, psychiatric records. We signed every release. They got every document and had them into the grand jury. I got copies. They have copies. Condi would testify to the horrific, in his opinion, failure to comply with the standard of care that would govern psychiatrists, psychologists, Dr. Tufts, who's going to be testifying tomorrow, nurse practitioner Gelada, the other individual from the McLean Hospital, all records that they've had for years. So they don't need time to prepare for cross-examination. So weeks ago, counsel, after I gave them copies of all of these reports and affidavit, strike that, I'm sorry, the reports I just got, and I just sent them the affidavit from Condi they already have, I disclosed to them what my opinion would be of the opinions from these doctors that would be testifying, and the report carries that out. I suggest to the court that to strip Lindsay's ability to present evidence in support of her defense, number one, it would not be in the interest of justice. I'd like to hear a DA stand up and say, in the interest of justice in this case, because weeks ago we got this information and we're not prepared to testify, to cross-examine the testifying witnesses, I think even Your Honor would agree is a disingenuous argument. She came in and said to you, oh, Rule 14 matters, and it applies to the government just as it applies to the defense, and therefore you should exclude these witnesses. Well, if I messed up, and it's my trial schedule that caused me to not be able to have written reports of the stuff that they've had for years to prepare to cross-examine these witnesses, then it's my fault, and it deprives her of effective assistance of counsel, because that would then deprive her of.
This man needs to be studied in law schools. This man is putting on a master class, and goodness, a humble man, a man that is asking the judge for mercy, a man that is admitting that, something might have slipped through the crack. But Your Honor, if you look at the face of it, I admit my mistake, but this is all information that they have had for years and years. And I am simply trying to prove the fact that my client did in fact try to end her life, a fact that the Commonwealth has been trying to negate this entire trial by focusing on the superficiality of, the neck and arm wounds and ignoring the thoracic and spinal and cervical spinal wounds.
Of her defense. This is a pathologist, an emergency room doctor, and a doctor who would testify to the standards that would apply to these doctors that they're going to call as their witnesses, which is another interesting fillip, if you will, where they're calling Tufts, Gelada, the other individuals from McLean, all treating physicians of her that are all lined up to come in and testify against her on this case. Fine, bring it. But at least give me the ammunition to counter it.
Let me ask you this, kind of go backwards. In regards to Dr. Condi, the affidavit really speaks more towards the standard of care.
That's right. He's not giving an opinion of criminal responsibility.
Right, but I'm struggling to see how that comes in. Now, maybe.
Well, he's the doctor that I'm using for toxicology.
That's what I feel. But the reason I'm asking that is I'm not sure in this case, is this the standard of care necessary?
JKD Buck, if I'm not the godmother, and I do mean the fairy godmother, I will dress up for this child. I will be very upset. And congratulations. I hope it's a girl.
Necessarily as relevant as to in regards as opposed to causation. Do you know what I mean?
Well, yeah, I think the standard of care does speak to causation. He doesn't have to use it as standard of care. He can use it as his opinion as to the first doctor that she spoke to, Dr. Tufts, when she presents with a bipolar 1 presentation, and then Tufts prescribes an SSRI to her, which flies in the face of any rational psychiatrist and what they would prescribe and do. He's more than qualified to testify.
That's a different question, and that may be more admissible than someone saying, oh, I found what the standard of care, and I find that this violates it. If we have got an expert who says, listen, I am qualified, I looked at these records, I disagree with that treatment, I'd be more inclined to allow that than to get into the standard of care, which is obviously consistent more with the civil
I understand that.
world.
So with that, I can reach out to Dr. Condi and have him delete reference to standard of care in his report and address the actual treatment as to an opinion as to its appropriateness. But again, on the issue that they're raising, that they need time to prepare to cross-examine, I don't think that lies when, even if he revises his report by removing standard of care.
Well, let me ask you this, because I haven't had an opportunity. This is probably what I'm going to have to look at tonight. Is Dr. Condi adding anything to the expert disclosures that have already been made? Because I know there's disclosures.
He's taking the medical records, Tufts, Gelada, McLean Hospital, and just commenting on the care and the treatment that was presented to her as a patient looking for help. That's all he's doing. He's not adding anything. He's talking about the prescriptions that were provided to her, the SSRIs, the antipsychotics, the benzodiazepines, all of that. That's what his opinion is predicated upon, which is all of the prescriptions that the government has already introduced into evidence and is well aware of.
Right, I understand, but I know that the parties have already exchanged reports months ago, and I know that everybody did that. And I haven't had a chance to review specifically the defendant's reports. And I don't, is there an expert who's going to address these kind of issues already?
No. Dr. Condi was my toxicologist and my physician that would give an opinion as to the appropriateness of the treatment that she received, especially as it relates to the prescriptions. I mean, Dr. Laposada is a pathologist. She has nothing to do with it. Dr. Zeisel is a psychologist. He has nothing to do with it. Dr. Resnick is a psychiatrist specializing in infanticide. He's not addressing that issue, and nor is Dr. Spinelli, who is a postpartum depression, postpartum psychosis expert. So Dr. Condi is my expert for toxicology and the level of care that she received.
All right.
Which guts the defense if their argument that they need time to cross-examine or prepare results in
Yes. Okay. Come on.
Thank you, Your Honor. With
Wah, 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 blah, blah, blah. I am stupid. I mean, let's imagine.
regard to Dr. Condi, one of my points is going to be that his affidavit addresses the standard of care, which is more of the civil issue, but you've already addressed that with defense counsel's pivot that he would then instead testify about the treatment of the defendant in toxicology. Looking at the affidavit in which he outlines his qualifications.
Blah, 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 blah.
Than just having the underlying data. It's also knowing more about the expert, being able to look into their publications and their prior testimony and being able to prepare to rebut any.
Like you were going to do any of that anyways. You have done less than a 10% of a half-assed job the entire time. So you seem to be unaware of the words that are going to come out of every witness's house or mouth. So I really don't think that if given the opportunity, you would do any better.
Anything that they might testify to, and where we have this late disclosure, which was 1 week prior to trial starting, that's fundamentally unfair to the Commonwealth. And I think what Dr. Condi would be testifying to, if it's just limited to her treatment and what was prescribed to her, that's covered by the other three experts that defense already has. They all talk about her treatment, the prescription she was on, and the effects those had on her. So I think that would be redundant, and it would be unfair to the Commonwealth to add this fourth expert.
Redundant. The Commonwealth wants to talk about redundancy? Thank God. Opening the door on that. Let's get talking about redundancy here, biatch. Because honestly, I mean, pot, kettle, velour jacket that doesn't match the dress, and terrible blowout.
To talk about the same things that the other three experts are going to talk about when we haven't had a chance to prepare for this particular expert. For Dr. La Posada, what we have is a 2.5-page letter to Attorney Reddington outlining her thoughts, but it doesn't say what her opinions are based on. It doesn't say which materials she's reviewed.
Yeah, and the defense in most things doesn't have to have their expert witness file a report. Dr. La Posada was in the John O'Keefe trial, the Karen Reed trial, and I believe she was the one that uh, was an expert witness for the defense that claimed that she had never seen any car accidents present with the kind of pattern of injuries that she was being presented in the case of John O'Keefe. I believe, I could be wrong, but I believe that she was part of the Karen Reed case.
And what she's relying on. So I would suggest that it's an insufficient report. And again, with the delayed disclosure, for example, she talks about Jefferson fracture causing the injuries. Well, if we had this information previously and knew this is what they were going to argue, we could have obtained our own expert to talk about the mechanism of injury and Jefferson fractures and all of those things. But we weren't told until a week before trial that she would even potentially be a witness. And then we get this report on July 26th.
So wham.
Couldn't surgeons who've testified, who treated her, couldn't someone just ask, is that consistent with, and that's pretty much, if I'm looking at Dr. La Posada's no. I'm not sure I would allow in opinions regarding whether or not it's a serious suicide or not, but she does indicate it's consistent with landing on somebody, on an individual's head.
Well, Your Honor, we had a trauma surgeon from the South Shore Hospital testify who said that the injuries that Ms. Clancy sustained were a level 1 and she had to be transported to another hospital where doctors who were trained in those injuries could operate on her. So we didn't think that she would have the knowledge and the training and experience to.
So you were precluded from getting the trauma 1 surgeons to come in and testify? I mean, scoot, asking for a friend, but aren't you the state? Can't you subpoena those trauma 1 surgeons to explain what a Jeffersonian, fracture is and how one could totally get that as a Spider-Man trick? It's like you suck at your job.
To testify about the nature of those injuries and how they occur. The trauma surgeon from Brigham and Women's Hospital is with the military and is overseas in the Middle East and so was unavailable. But had we known that this was going to be an issue and they were going to allege this particular type of fracture, we wouldn't, but we didn't know.
They didn't allege. It's in the medical documentation. It's not an allegation. It's a diagnosis, you dum-dum. Thank you for joining the School of Mo, where we do offer, positive reinforcement, but only if you earn it.
That this would even be an issue until a week before trial, which record that these opinions are based on.
Well, that could be done by voir dire.
The judge is like, you're an idiot. I can see an easy way to fix this. Let's do it the easy way.
The Commonwealth has at least inferred through their case that this was not a serious suicide attempt.
Oh my God, a judge that's paying attention? A judge that is watching the same trial we are watching? In Massachusetts? It's a effing miracle. Bev, take notes.
Right? I mean, and there's questions about whether or not somebody's hanging outside the window or not. And so why wasn't this an issue that the Commonwealth could have anticipated would come up?
The position of the Commonwealth isn't that it wasn't a serious suicide attempt. It's that the methods that were chosen were insufficient to achieve the goal. And the reason.
What? Explain how that's any different than bitch didn't try hard enough. And I'm sorry to be so crass, but that is legitimately what the state has been saying the entire time. And she's like, no, Your Honor, that is not what we mean. What we mean is bitch didn't try hard enough. which is exactly what you just said, but we are going to argue and say we didn't say that. And then, again, your entire first 2 weeks has basically been, she is faking it. She's faking it. And then she has the balls to say, "No, Your Honor, we have not in any way tried to denigrate, that woman." I won't even say her name half the time. Whatever happened to her, like her little ouchies, like, we have never said that. We have never been saying any of that. Like, what are you talking about? Like, at this point, the bow should the bows, listen to me. You don't have to stay there. Now, I firmly believe that with the right amount of, well, nearness to a nexus of evil, you could gain sentience and you could walk the hell away. Bose, I'm saying, pull a Toy Story and go full Sid on her. Allegedly in Minecraft, Bose, you do what you want. But if you happen to go full Sid, I'm just gonna be sitting back here.
Reasons for that, we would argue in our closing. I don't think we have to disclose that theory at this point, but we've never said it wasn't a serious suicide attempt. We've never said it was a fake suicide attempt. What we've endeavored to develop from the testimony is that the methods that were chosen were methods that would be unsuccessful, but we're not saying it wasn't a serious attempt.
The leap out of the window was fucking successful, but we gave her medical intervention. How retarded are you? Legitimately, someone give me the whiteboard so I can make this make sense. Lindsay legitimately coded and died. Like, she didn't even, like, try. Like, she didn't even do a bend and snap. I mean, like, was she even trying? I have never hitherto said this, but, Commonwealth, I am going to need you to stop, and for your body types, it's always semi-miraculous that you continue to do this at the end of each day, but you really need to stop limboing under the lowest common denominator. Um, I don't know how you're gonna keep doing it every day.
Attempt. And I think the reasons for that will become clearer when the doctors give their testimony. But it's our position that she was attempting to kill herself that night, and there are various reasons and factors where she was unsuccessful in killing herself, but successful in killing her children.
So let me get this straight if I can. You have spent the majority of your time explaining that this woman is a manipulative liar who was faking all of this. But now you're like, "We never intended to do that." Like, I just don't even know what trial you're watching. But obviously what we're trying to convey was, human kindness. The Borg needs better programming. I don't know what, if this was the beta version, y'all need to fire your, is it the Benny Trelu or the Benny, Taylaxu or the Taylaxu? It's the Taylaxu from, Dune. They need to fire them. They've obviously given you corrupt technology. Yeah.
But there's been all kinds of testimony regarding, it seems to be a dispute of whether or not she's hanging from the windowsill or goes out head first. There's some testimony that's been raised, even with the blood experts, things that she may have been hanging from the windowsill. Dr. Laposado, it seems what they're seeking in is those injuries are consistent with somebody who lands on their head.
So would the court allow us to call a witness who's not on our witness list to rebut that evidence?
Yeah, I would consider that.
Yeah,
Sure.
I would have no problem
Yeah.
with that.
And this is kind of what, why I didn't make a decision on this.
Oh my god, oh my god, oh my god, oh my god, oh my god. I just realized who she's gonna call. You guys, we're getting Judson Welcher back. We thought we were done with Judson and his blue paint, but we are gonna get a new enactment. I do hope he goes the full mile and he wears what Lindsay was wearing. But you guys, Judson, come back. Any kind of fool could see the Commonwealth needs you and everything blue paint. Come on, we need you, Judson. We need you and your blue paint. Dutch boy, lead based. We're here for you.
Earlier, because they had to kind of see how the case develops. And this issue of how this injury occurs is certainly, it's either been specifically and explicitly raised or inferred in multiple questions. Even to the length to the part, the cuts and things like that. It's been over and over and over.
God, a judge who's listening and watching and paying attention to the trial in Boston. It feels like, or Massachusetts. I don't know why I always go the city and not the state with that one. I am fully aware that Boston is not the state. It is Massachusetts, but this is miraculous. Like, if you are a practicing Catholic, we might want to put this on the calendar to look at the Vatican possibly like canonizing just this day that something miraculous happened in Massachusetts. He does snipe hunter. Our backstory for this man is that he was the unlikely biological love child of Phil Donahue and Jerry Springer, and he decided to use both of those talents to be a judge and have a great head of hair and give us final thoughts.
So if the Commonwealth seeks to get somebody to rebut that, I would strongly consider that. And in regards to Dr. LaPosada's opinion, we may need a voir dire in regards to, but I wouldn't imagine the voir dire would take that long. It would be, did you view, the x-rays? I mean, that kind of an injury is probably pretty clear on the x-rays or the MRIs.
If we could get a list from defense counsel on what she's basing her opinion on, so we can have our witness review the same material.
I'm just telling you right now, it's just simple. It's just the South Shore Hospital medical records, Brigham and Women's medical records that have already been discussed with the jury.
Why don't we do this, just so it's clear, because when the witness is on.
The defense is like, it's going to be all their discovery. All they need to look up is Lindsay's medical records. It's almost weird. Like, I was able to do this on my own with no help. And yet they had colossal tons of help and they couldn't figure it out. And yet I had to call them competent. Your Honor, I am seeking damages.
Understand, it's much easier to have something in writing to say, is this what you relied on? So if you could get from Dr. LaPosada what she is relying upon to form that opinion, I'm like I said, I'm inclined to allow that opinion, and I would allow then the Commonwealth to present a rebuttal witness if they seek to.
And just note our objection
Sure.
to that, but also the third expert, what we have here is a letter dated August 4th. That's a page and a half. That's not even signed by, I believe it's Dr. Volkovich.
Yeah. I'm more concerned with that is whether or not the opinion is admissible. The opinion, as I see it, is he's reviewed the medical records, and it's his opinion these are injuries that commonly observed in, the quote is, serious suicide attempts.
We could delete serious.
Yeah, I mean, or even suicide attempts. That's an opinion.
Their doctors waxed eloquently about suicide and whether or not it's, I mean, they delete serious.
But I'm just concerned that how are we going to kind of parse out what he looked at, 100 other cases, and then we go through into all of those. So I'm going to have to take a look. That's what I'm going to take under advisement for sure. That doesn't mean he may have other opinions I'm going to have to look at. I think he talked about some of his observations as an emergency room doctor, I think, didn't he? Yeah, I'm more reluctant to allow in that individual's opinion that this was a suicide attempt.
So their South Shore doctors are able to talk about, superficial, as we've heard for a week now, but his opinion that it's consistent with what he's observed in his emergency room treatment is not admissible.
No, that's not what I'm saying.
Oh, I'm sorry.
What I'm saying is that he can't necessarily give the opinion, I've looked at this, it's my opinion, this was a suicide attempt. But he could certainly testify, I've looked at the cuts. These are, the phrase superficial. I think that's been kind of mixed up in this whole thing too. That seems to be more of a medical term as opposed to.
Oh my God, Judge, did I just fall in love with two older men in one trial? It's like my own personal grumpy Muppet men are really happening. Oh dear Lord. Mr. Mo, watch out. If these two grumpy old men go on tour, it's done. American women and men across the sea are from seaboard to seaboard are getting pregnant.
Well, no, they basically beat it to death with not being a medical term until we were able to show that in fact it was deep, 3.5 and 2. Okay.
Yeah, I mean, if you want to call this doctor, he's going to say that's a significant cut.
Okay.
That's different than saying, looking at that, I find that this is a suicide attempt. Just like there's never been an opinion here that this was not a suicide attempt. That's probably something that the jury
now, but it wasn't a week ago.
Well, that's going to probably be for the jury to determine. But I would allow kind of going into the characteristics that have already been testified to. And I don't. We need a further voir dire on that doctor as well. But I think he lists in there kind of what he reviewed. But
He did.
yeah. Yep. All right. Anything else in regards to those three witnesses?
Nope.
All right. No. So I'm going to take this under advisement, but just kind of for what I'm inclined to do is I'm going to take a look at Dr. Condi's report and compare it to some of the other reports. I'm inclined to let Dr. La Posada testify that the injuries are consistent with basically a fall on the head. And the last doctor, I'm going to take a look at kind of his language, but I would not be allowing in that his opinion that this is a suicide attempt. But he may testify as to all the other observations that he took from those records. All right.
Understood. Just no my objection for what it's worth.
All right. And so I'll note the Commonwealth's objection. I'll note the defendant's objection. And so, and like I said, I'll take it under advisement and everybody can renew those objections
As
again.
it relates to Condi, once you make your decision, you let me know. I can certainly reach out to him and have him delete this standard as to standard of care and just reference the actual treatment and prescriptions that you received.
All right. All right. So I'll take a look at this. I'll have this tomorrow morning for everybody when you come in.
Great.
All right.
Thank you.
So anything else we need to address?
That is putting together an auto computer animated display of coming out the window, the injuries to the neck, showing the vertebrae and that type of thing, which is all based upon evidence that's already in evidence here. So I haven't got it yet. It's not done yet. So I don't want to not say anything about it now because they'll be objecting to it tomorrow, I'm sure.
I assume I assume we'll have to take a look at that.
Yep.
And give the Commonwealth the opportunity to review it and hear the arguments in regards. It may be something nobody has objected to, or maybe, I don't know. All right.
It
You don't know. You haven't seen it.
goes back to the whole position that, we have the right to, if we want to obtain another expert, and then
Sure.
that expert could review that material and use it to form his opinion. This is different than the 3D diagram of the house that the Commonwealth gave. The defense was on notice that was coming, the basis of it, the measurements, what the house looked like itself. And so that was turned over. This is completely different.
And I just note that, as I said, the medical records that the government has talks about Jefferson fracture. You might remember 2 weeks ago or 2.5 weeks ago when they first raised their objection, I told you that I can't know what they're going to argue until they argue it. So I didn't know whether or not they were going to say that it's a fake suicide or that she didn't jump out the window. I had to wait to see what their opening was. Now I know I have to rebut it.
We were almost out of here till you mentioned that 3D thing. So why don't we do this? We'll wait on that. All right. I'm not committing one way or the other in regards to that. We'll see. And so you maybe the testimony with the 3D, the testimony without the 3D. We'll just kind of see where we go. All right. All right. So thanks everybody for kind of buckling down and going through that so we can resolve that as best we can. I appreciate that.
Thank you, Judge.
So we'll be in recess on this matter till tomorrow tomorrow morning at 9 o'clock. All right. Thank you.
All right, guys, this is where we are going to call it a day today. I am sending you over to Captain Kern. He is doing a wonderful week-long, I believe, stand up to cancer builds for charity. He does 3D printer modeling, which is something so far outside of my comfort zone that he starts to talk about it, and I legitimately get like scared feelings because computers are scary to me. But he does really wonderful stuff. He has a wonderful story. He is a great guy to listen to. He also deals with chronic pain, and he's just a really good guy. So give him a chance, and share out that stream. He is doing this. I think he did this last year as well, and I don't know what trial I was in, but I didn't promote it as much as I wanted to. So definitely be sure to check it out. And cancer is one form of evil that we can all fight together and hopefully win. So let's see if we can do that and help Captain Kern. And I will see you guys. I think I'm going to be hanging out on Nick's stream a bit today, and then going over to Shizzy, and then Friday night live. So hang out. I will be there, but I do need to get some food in me, or it's going to be lights out by 8 o'clock. So bye, you guys.